Okay, it is 2:30. We will go ahead and get the study session started. Mike, you have any opening comments, or we turn it over to Natalie?
Well, I guess I can make some opening comments. As part of last year's budget, we looked at the health insurance fund balance and the target balance and what we were experiencing, and we took a kind of a holiday for a little bit in terms of making payments and transitioned that to the general fund. And then as part of this year's budget conversation, it came up again of where are we at on the fund balance, and is there an opportunity there? And I told you at that point, I really wanted to look at it a little bit more systematically and consult with our consultant on the topic to come up with a strategy as it relates to the timing of when we would look at making that kind of decision and how we determine what our reserve balance should be, and then how we might apply ourselves if we, in either instance, whether we're exceeding the target fund balance or below it. And so Natalie's coordinated with Bob Charlesworth with Charlesworth Consulting, who assists us with our health insurance plan. And we talked a couple months ago and kind of talked it through, and I think came up with some good items for your consideration and a pretty good strategy. So Natalie's going to give you a little bit of an overview of our health plan and coverages, and then we'll turn it over to Bob to talk to you about reserve balance as well as upcoming insurance renewal. So with that, I'll turn it over to Natalie.
Like Mike said, just wanted to give you a brief overview of our fund and the components of it and some of the elements that we manage within it. We established this fund in 1996. That's when the city opted to go to become a self-funded employer. And I say self-funded. Technically, you could consider us partially self-funded because we do purchase some stop-loss insurance, and we'll get into more of that later, and we do contract for administration of our claims to be paid on our behalf. But how we work in terms of our insurance is we do charge internal premiums. We get contributions from both the city as the employer as well as our employees. We split that. And then you might recall, in addition to our employees and any of the dependents and spouses that they have the ability to cover with our plan, we also cover our subgroups, which the Housing Authority, the Public Library, the Airport Authority, and then our retirees. There's 3 different elements within the coverage. We have it currently carved into medical. Our third-party administrator is Blue Cross Blue Shield of Kansas. They also provide the stop loss for us, and again, we'll get into a little bit more in detail. Prescription coverage is by Elixir. They just recently had a name change from MedTrack. They are prescription benefit managers. Then in addition to the medical and the prescription, we have dental, and this has been Delta Dental of Kansas since the time that we became self-funded, I believe. We really only have one plan. So it isn't that people opt in for different levels of coverage. We have one plan, and then they can opt to cover an individual only, an individual plus one. That plus one could be a spouse or a child, and then a full family. In terms of what that coverage looks like, our medical coverage is a 50-50 share plan. That means we share the costs with the employee, the plan and the employee divides that, up to reaching $2,000 individual and $4,000 family. Now, with the Affordable Care Act a few years ago, and a change of structure, we had a lot of services that are considered preventative. So even though we say things are covered 50-50, there are a lot of services that individuals have access to that are considered preventative, and therefore our plan would cover it at 100% with zero cost to the employee. Currently, our prescription coverage is a 30-70 split. The employee or plan member covers 30% of that. The city picks up the other 70%. And then Delta Dental, we just have a maximum benefit set aside for dental work. That's $1,500 per plan member per year. A note with the ACA maximum out of pocket, and we see this mostly with the prescription and the medical, even though there's 30% to the plan member and a maximum of 2,000 individual, for example, once they hit 8150, for the most part, their coverage is, that's capped out. So that is their maximum out of pocket. The city doesn't have that, any maximums set there, and again, we'll get a little more into that soon. I wanted to give you an idea how we are charging those internal premiums. Information provided for both full-time and part-time. It's about an 80-20 split for employee versus city for full-time, and close to a 50-50 split for individuals that are classified part-time. Like I mentioned, the Blue Cross Blue Shield of Kansas is our third-party administrator for medical. And along with that, we pay fees for each individual that is enrolled on the plan. Those fees cover not only administrative fees to process the claims, but also the stop loss. Currently, that stop loss is $150,000 per individual. So in the event medical issues cause claims to exceed $150,000, the city no longer has the obligation to pay for that individual. That's where the stop loss insurance picks up, and that's through Blue Cross Blue Shield. That's medical only. And then in the event we would have collectively just not one of our best years, if our claims hit 130% or higher through Blue Cross for medical for our whole group, then we are no longer funding those claims, and that's where the stop loss picks up there.
Point of clarification on
Yes.
that. It says 130% above. Is that above or of? Because it makes about 100% difference. I believe in Mr. Charlesworth's presentation, he says of. So 130% above would be, the attachment point would be at $230. If we had $100 in expected claim, if it's of, it's $130.
All right. So I should have phrased that different.
So that's
Did you hear him?
really-
That
that's
is,
really
it should
of.
say of.
Okay, thank you.
Could I just, and that is the whole group, and not for an individual person, or employee, but group-wise? Okay.
Correct. At the time that we renew the contract with Blue Cross Blue Shield of Kansas, they provide us the number of here is what they project to be expected claims, and here is the calculations. So here is the point at which the stop loss would pick up. So they provide that in an actual dollar amount with the renewal documents. Just a sidebar, Blue Cross Blue Shield does have very good discounts, and we factor that into us contracting with them. The access to those discounts has saved considerable amounts of money for our plan.
Do you mean negotiated rates? Is that what you mean by the
Yes,
discounts?
provider
is
discounts.
Negotiated rates,
So,
okay.
You know, for example, a doctor's office might typically charge $150 per office visit. Blue Cross Blue Shield of Kansas may have a contracted rate of $125. So they write off that $25, and that's the most that the plan would be charged. And then a little bit about our fund. We had deemed that our target balance was at $2 million. As of the end of September, our target, or our fund balance itself, was 2.897. So we have had the luxury of having that trend above. Current plan year is February 1 to January 31. And then I did provide a historical perspective as far as where our fund balance has been on a monthly basis over the past few years. So where we need some guidance and some structure and some policy created is what happens, and when should we be looking at that fund balance, and what action should be taken. And we need some guidance, and those are going to be some of the things that I transition and ask Bob to cover, some different approaches, and to also get some feedback from you. You know, what should that balance be, and when should we be looking at that? And then in the event it's higher or lower than we would like it to be in terms of target, you know, what do we do? So with that, I'll go ahead and
Thank you. Good afternoon. My name is Bob Charlesworth, Vice President of Charlesworth Consulting. We're at 1828 Walnut in downtown Kansas City, Missouri. Of course, I'm working out of my home in Olathe, Kansas right now. So thank you for having me this afternoon. Actually, it was not a bad drive coming out at all. A little bit dicey around Lawrence, but other than that, it was pretty good weather so far. Today, I want to talk really about two major topics. The first one being is fund balance, reserve fund balances. The $2 million was kind of a talked about number, and I thought it would be important with Mike's direction. Probably be important to talk about how did we come up with that number. Put a little bit more specifics as to how it's calculated, and that way we can all get an understanding of what is at risk and what is not at risk. I've got two concepts here outlined for you to look at, and I would like some discussion, or you can think about it whatever you'd like, but let's walk through them just briefly. We're going to touch on this a little bit here, but the amounts that the city takes as risk, we talked about specific stop loss per individual at $150,000 per contract year. And then in aggregate, the worst case scenario for all claims, all combined for that same contract year. And yes, it's 130% of expected. And so you look at that corridor, what you expect and what the worst case scenario is. And that is an aggregate stop loss attachment amount, that corridor, if you will. So one concept is we take 1 month of claims for up and down swings. As you saw the claims experience that Natalie had, claims go up and down, matters what large claims may happen, when they're paid. Right now we had a dip because of the COVID claims. A lot of those services they're waiting on until now to start their normal procedures to kick back in. I know I had one delayed from May until August. So there's some up and down swings in claims. A month and a half of claim for terminal liability. And what that is this, a little different, a little asterisk at the bottom. If the city would ever make a change of carriers to go fully insured, to do anything else, the city is still responsible to pay claims for when you were self-funded. Now, you may get a claim in December, but not pay it until February or March. Well, the contract's already ended. So you have the responsibility to pay that. That's what I call terminal liability, or claim run out, if you will. That's calculated every year, about 1.5 times monthly claims. If I took the lag report of this very cities, you would find it would be about 1.2 to 1.3 maybe. 1.5 is an easy number. That's where that amount comes from. And then you look at, and we have an example for you to see for your renewal in just a minute, where I came up with this $1.5 million magical number. What that is actually where the carrier comes in and says, we expect your claims to be X. You know, we'll go over those numbers, $3 million. Worst case scenario is Y. That difference is about $1.5 million. Why? Because we don't know what our claims are going to look like. So we have to have some cash flow possibilities. If you just add all that up, it's $2.4 million. The other concept is, you know what, Charlesworth, that's fine, but we have reserve dollars already. We have a month and a half of claim terminal liability. Our intent is not really to term claims, but we need that money available. And yes, we have the aggregate stop loss attachment at risk all the time. So that's $1.5 million. So let's leave it at $2 million, in this case, $2,052,000. Thus, the concept a minute ago, good number is $2 million. Well, this is actually a calculated number that we can do every year. So those are concepts that I've come up with. Now, a while back, before we could get a lot of claim data, there were some what they call safe harbor limits, and that's changed terms now. But the IRS kind of says, you know, it ought to be about 30% of annual claims, blah, 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 plus administrative costs. And that could have calculated to be over $3 million. Well, today, with claim data you can find, you can see what the city's lag reports are, our terminal liability is, and everything else. So really, this is very known, and I can calculate every year. So this is the concept that I'm laying out for you to look at today. And now, in a minute, we're going to talk about what do you do if it's short, and what do you do if you got too much. But I think the concept right now is, where does the city want to look at regarding, this is where we're comfortable with our claim reserve for our health and RX fund. Now, in a minute, the reason I wanted some higher limits, I'll be candid, is that we've carved out the RX program years ago to the stop loss, so the city had some elevated risk on pharmacy claims. You really haven't experienced elevated risk until this year. And I've got that information for you. A little bit of a bump, but my point is that it's time to probably consider rolling that in to your Blue Cross plan instead of having it carved out. So the city has the protections of stop loss, but right now you do not. That's why I was pretty hesitant about not saying, yeah, let's make it at $2 million. Let's come up with a calculation. And by the way, these calculations do include the pharmacy costs that I'm talking about going forward. Again, when to calculate is a good question to have. Mike grilled me on this one. I thought it was appropriate. So what do you do if you have positive monies? Well, you're the city commission. You all can decide what you want to do. But, one of them is declare a premium holiday, perhaps in October, to be realized in December. It's just timing. In other words, premium holiday employee, we're not going to take your contribution out of your check. You're paying 30% of that amount. We're just not going to do it. We're going to waive it. Why? Because you've done great. This is your reward for managing your claims. We can buy down renewals with it. If it's just a little bit of money, we can say instead of increasing our rates 5%, let's increase it 3%. City pays 70% of it, employees pay 30% of it. We both win. So you can buy down renewals that way. It's one-time monies. You can create a health reimbursement account. That way employees can have that with their current plan, and they can use that like a flexible spending account and other things. A little cumbersome, can include some fixed fees. If it's a sizable amount, that's a nice alternative. We don't see that a lot in my business, but it is an option. And then, of course, a percentage of city contributions can be swept back to the general fund or wherever you get the funds of which you use. But I think it's important that you realize that some of those dollars are obviously employee contributions and city contributions. And the reason that they're positive is through employee engagement and utilization. So if the city says, you know what, we're just going to take it all and sweep it, I have no issue with that. And the reason is the city has the financial risk for this plan. The financial risk is on you as a city. So that is one thing to think about as well. So the flip-flop of that is okay, what if we have a bad year? And you can have a bad year. Let's see here. Sorry, I've had some. I know back in 2017, there were 3 claimants over $150,000. So obviously every claim up to 150, the city shouldered those in your costs. Well, this year you're at 0. It's knock on wood, doing great. Last year you had 1, 2 years ago 2. So it does happen, but they can be negative. So I don't want the city to say, wow, we had a shortfall of, easy numbers, $100,000. We're going to add $100,000 to the rates and share it all. Well, you can do that. Or you can take and say, you know what, based on the fund balance shortfall, we'll take 20, 25, 30%, whatever, and add that back over a 3 to 5 year period. In other words, ease back into We had a bad year. We're going to modify that a little bit going forward to help build that fund balance back to $2,052,000 or whatever number is y'all decide. Point is that there are actually ways that we can monitor this every year for you to see how it should look. Now, I don't know if you want to talk about that, but I've got your renewal information here. It might be helpful to see that first, so you kind of see what we're predicting for the future. My Ouija board's pretty good, so, and Blue Cross's numbers were good. But here's a quick summary of the 2021 forecast. Blue Cross actually expects your claim cost on medical side to go down 3.57%. Yes, we had some really good claim years so far. No claims through September for large claimants.
Compared to
what they predicted for this current year. So they predicted a certain amount this year, and for predicting next year, they actually think it's going to be down 3.5%. And that includes medical trend.
So if 2019 was the last real year, I mean.
Correct. There's a lag, but they do take.
Well, I mean, as far as non-COVID, because personally, I have a lot more money sitting in my Flex account right now than well, it's good that I haven't had to use it, but I'm trying to say, oh, what do I need to get done?
Mm-hmm.
And I can't imagine that there aren't other folks in that area, but a lot of stuff just hasn't been getting done. So when it bounces back, it's going to bounce back to 2019, not to 2020.
It can. And some insurers are predicting that to be about a 5% swing. So but they've taken that into your consideration based on your claims through, I believe it's through June when they calculated this. Because they let claims develop before they go act and actually predict the future.
Mm-hmm.
Now, here's on that very issue, the next one is the pharmacy claims. I pulled the information up from your current provider. It's actually, claim payments are down 6.7% from the prior year. But I'm actually projecting up 5%. And so when you look at that, it says, well, I ought to see a rate decrease or funding decrease on that. I'm going, no, I'm not, because there's some large claims in there that we've seen. I'm going to touch on those in a second. And there are some that have been, you didn't get the services or we don't know. And claims costs on pharmacies are going up that it's going to be hard to predict in the future.
What portion of of the premium is allocated to pharmacy costs?
It's about 25%.
About 25.
Yeah. Yes, sir.
So when you talk about 5% up, you're talking about 5% of 25%.
Correct.
Which is about a 1% overall.
Correct.
Okay.
And then the administrative fee is up 3%. Just in a minute, we'll show those actual numbers. Administration fees are claims administration, Blue Cross going out and getting the discounts, negotiating the pharmacy network discounts, et cetera. 3%, and the administrative fee is about 10%, 12%, not even that much, probably 8% of your overall cost. So it's a very little number. And then your stop loss premium actually went down 15%. You may recall last year when I was sitting here, we got an increase and we're going, why? Well, we did have not a good year, but we're having, I say we, the city, is having a very nice year. And Blue Cross statewide has done okay. They're a little concerned going forward because of the number of the large pharmacy claim issues that they are starting to see. But that premium did go down. Now, the expected claim number, as you can see, is only down a little bit. But that actual premium to transfer that risk under 150,000, or excuse me, above 150,000, that premium went down. So that was a nice addition to see for the city this year. I'm going to have two options for the city to look at. One is a renewal of the current program, and how that is allocated is Blue Cross Blue Shield of Kansas has the medical and medical only stop loss. So when we talk about medical only stop loss, anything that is handled via the medical claims, which could be inpatient, outpatient, how that's managed, all that goes up to that $150,000 stop. Anything above that, Blue Cross pays, but the city pays under $150,000. The Elixir, which is used to be called MedTrax, handles that pharmacy benefit program. And again, the city has the full RX claim cost exposure on that. Option 2 is to have Blue Cross Blue Shield of Kansas include their pharmacy program, which is called Prime Therapeutics, and eliminate Elixir. This way, that risk of that stop loss can now include pharmacy claims. Now, as you can see, the net add is about $124,000 of fixed cost. So if you look at me and says, Bob, over the years, how come we haven't done that? Well, because we've saved about $130,000 a year in premium, pure stop loss premium, to accept that risk. My concern today is how pharmacy drugs are looking in the future and the city's specific claims experience. My recommendation would be to consider moving it all together. Again, this is a stop loss summary, $150,000 per contract period, medical claims only. Option to move the pharmacy program to Blue Cross Blue Shield of Kansas. And then the aggregate stop loss is 130% of expected claims. Of course, now the stop loss is up a little bit from what you may currently see. Why? Because it's 30% added to pharmacy claims, when before that was not the case. So it skews the numbers a little bit, but at least the city would have full protection at that point. I wanted to show you some pharmacy expenses, large claimants. I pulled the top 5 claimants. Obviously, I don't get names, and I would never share them with you anyway if I did have them. I don't know who they are. I don't know if they're employee, spouse. I don't know. Don't care. I just want to make sure that they get their claims and they get paid, and the employee gets taken care of. But as you can see here, on claimant 1, 2, 3, 4, and 5, the number of claims that they incurred, what the plan paid. Now, if this claimant number 1 didn't have any medical claims whatsoever, and they may not, except their daily, when they go see the doctor, twice a year or whatever, that's $176,000. Well, the city could have stopped that claim at $150,000 if it were included today. Now, the city would have paid another $125,000 for that feature. But this way, if we look going forward, second claimant's $147,000. And so, as you can see, this is kind of a year that while our claims experience is good overall, we are starting to see a little spike in what we consider pharmacy claims.
So we have only one claim that qualified for stop loss.
It would have if it was under the stop loss program.
That's what I'm
Correct.
saying.
Yeah.
And this is the first time this has happened in the history of the program?
Based on my knowledge, it's about right. I'd have to go back, Rod, and double check.
We've been
But
in this since 1996.
not carved out like that.
Okay, yeah, it was carved up in the early 2000s.
Yes.
Roughly 20 years.
Correct.
And on this, the third column, are those just the pharmacy expenses?
Correct, sir.
So no office visits, no,
No office visits, strictly pharmacy claims. And that's what the plan paid, which is the city. Again.
Are these negotiated rates? They're not, because we're not going through Blue Cross?
Oh, no,
but
they're fully negotiated.
They are?
Yes.
Okay, the pharmacy claims?
Correct.
Okay.
As a side note, sir, I did compare the pricing discounts of each of the firms, and the Prime Therapeutics is slightly better.
Okay.
I'd share that with you, but it's filed confidential data, but I can tell you that it is slightly better.
with the employee, I kept getting ready to say patient, but is the employee's share of the cost of the drug at the pharmacy the same under the two different
Correct.
plans?
They do. And of course, if the discounts are better, it actually helps the employee, since they're paying 30% of it.
Do you know right off the top of you, and just your personal judgment, are the formularies equivalent to each other? Is one a lot more restrictive than the other?
We can get more restrictive, but that's not what I asked them to provide. I asked them to provide as broad a network as we could get. So there is room to control the formulary closer, but I'd like to see the disruption report first before I would recommend that. because you might.
As I get older, I'm going to see it wider, personally.
Exactly,
Well, yeah,
exactly.
Yeah.
Yeah.
I think so much, I mean, the formulators are important, yes, I get that. I think the management of the claim is the most important. You know, to make sure that they're getting the drugs that work. You know, yeah, I want the best discount I can get, but I also want something that, you know, I don't want them to give them a 90-day supply when after 10 days they figure out they can't use it. I'd rather them manage that more so than just, you know, oh, we got a little bit better discount or controlled.
Makes sense.
So, but that is something that the city will need to review as it goes on, because those formulators are getting more restrictive, because it's expensive. So,
So just for my simple math, if the premium or the extra cost to include the pharmacy and the stop loss is $120,000, we would have to have that many people up below the 150 we're paying anyway. So it would be the excess, kind of like health expenses on adjusted gross income, but it's only that excess over the 150 that's going to count towards, was the 120 a good bargain or not?
that's correct. And right now, it's very hard because I cannot combine the two datas with individual IDs to figure out what that crossover would have been. So that second one at 147, did they have medical costs of 100? Well, that'd have been 247, and then the city could have gotten essentially $97,000 back from stop loss.
I figure this is just pharmacy.
This is just pharmacy.
So the medical would push a lot of those over the
It
150.
could. I mean, you know, if you look at the actual drug that's issued, some of those can be already paid for right now with Blue Cross because they're done in an inpatient setting. This is not an inpatient setting.
Right.
So, I mean, the city has some protections there, but it's just easier and more controlled, and gives us more data to review to make sure that we're doing the best not only for the city but for the employee by combining those together. But I'm just showing you some of the risks the city has taken, which is fine. The city has saved that premium. So even if it is just the one person, well, you would have spent $124,000 to get, you know, 26 back. Well, you're 100,000 up.
That's presuming the medical side didn't drive it over, and we have no way of knowing that.
Mr. France, you're exactly correct.
Am I correct in that?
That is correct.
Okay, so it's not fair to say we're saving $25,000, but we're going to spend $100,000 more in premium,
Correct.
even though we've only been hit this way in 1 year out of 20. You can't make that an apples-to-apples comparison.
That is correct. Absolutely.
Well, thank you for rescuing me, because I was about to do that. Because that way makes no sense.
So then we don't know who else would have had medical bills of $110,000, yet low pharmacy costs, who would have,
I'd have to go back and get individual reports on every individual on both the pharmacy and the medical and combine that somehow.
Or at least look at the significant claims in each, and then, and rather than compare every single
Right.
one, you could.
Because that stop loss is individual. It's not per family, it's per person.
Per person.
That's correct. But as you can see, just from this slide, whether, you know, it was included, or, I mean, if it would have been just that piece or not, you can see the volatility of it. And to me, that's what I'm concerned about moving forward. I would rather have that volatility and control under one document with stop loss protection for the city, especially if we're looking at establishing a fund balance at X. That we would control what is at risk and what is not at risk. This is just an FYI. This is your pharmacy pay claims, year-to-year comparison.
Speaking of which, do we pay differently for generics than we do for brand name?
Meaning what, sir? Discount
Is it still a 70-30?
Still a
For both?
70-30. That way the employee makes a decision, can make a decision. I'd rather have the brand, yeah, it's fine, you pay 30% of that cost.
Yeah.
So you have to ask the question.
But it also costs the city a bunch more. And some of the pricing on the brand names are pretty attention-getting.
Very.
Yeah.
Just as an FYI, I don't want to be mean to the incumbent on the pharmacy. We do get notifications on large claims to have the city review that. Is that appropriate? Do you understand it? Yes, yes, yes. So it's not like they're just willy-nilly approving everything all the time. So they're very controlling. That's controlling. They do watch your checkbook. But again, Blue Cross expects the city's claims to be about 1.3 million for next year. Probably a little light, but when we see the totals, at least you understand where those claims are coming from. Just an interesting stat. As you can see, the employee pays about 16.7%. Well, excuse me, 16.73 per member per month for employee, what the employee pays. And if you did the math, city pays about 85%. Employee pays about 15% of the overall cost. So I'm getting way ahead of the game here, but that's kind of what I do. This is 2022. We are going to talk about 21, and we're not going to go away from that. But we've had a lot of discussions with city management to talk about, when we get our renewal, when can it help in budgeting processes. If the city would look at a January 1 renewal, right now you're February 1, which is fine. January 1 obviously is the most prominent renewal date. However, we can probably get, and not probably because I have other public entities that do business with Blue Cross of Kansas, get early renewals in July to help in their budgeting process. So when we project forward, the city has a better idea of not only what the reserve fund should look like, but what the future of your claims may look like from their perspective. That way it also follows calendar year benefits. So we talked about this in work session last year. I want to let you know it did not fall on deaf ears. But I think whatever the decision is made by the city on your renewal to go forward, I think what I'd like to consider for next year's looking and directing Blue Cross of Kansas to move to a 1-1 contract period. That way we can get the renewals a little bit earlier.
What kind of impact? I'm sorry, I didn't mean to interrupt.
I'll remember my question. Go ahead, yeah.
Because I'll probably forget mine. What impact does that have on HR staff in terms of switching to a 1-1 renewal date? Is there, does that put any additional stressors for you all, or?
Yeah, there's actually some benefit to it in addition to having it align with budget. I believe we can take advantage of some efficiencies in our new software, that we can set some things for plan year and do some different adjustments that we haven't had the luxury. I will mention Jennifer Perry, our benefits coordinator, one of my staff members. We joke she also has other titles informally as life coach and employee advocate and about 15 others because of how many things she does for our employees. But I'd have her comment if you have any other thoughts on the change.
I actually think it will be better. It'll be better for employees because most of their spouse plans.
You want to come up here? You want to come up and speak at the microphone, please?
I actually think it would be an improvement. Little work up front, moving open enrollment around, but other than that, I think it would streamline things to fit better. Other plans typically renew 1-1, so we always have the confusion with employees and figuring out spouse plans. So I actually think it would probably work.
I guess, the other way to look at that, my wife happens to renew March 1st. And I know physicians hate January because everybody's in their deductible. So there's very little cash flow coming into a physician's practice in January and February because all the plans reset. If you're trying to get stuff done at the end of the year and the doctor's on vacation, you can't get it done until January. Well, guess what? Your deductible has been set back to zero again, or actually set up to $3,500 or whatever it is. So there's some practical reasons to not have, worry about big cash out of pocket right after Christmas when most of us probably have the least amount of cash in our pocket. There's another side from the consumer aspect. I can understand having spouses' plans on the same calendar. It makes it easy from the accounting end, but there is a cash flow disadvantage to having it so early in the year.
Yeah, I would point out that's a little bit moderated in our plan because we have a 50/50 copay, not a full deductible to a specific amount. So that's somewhat true because you may be over your copay maximum at the end of the year, but it's 50/50 instead of, an 80/20 or a flat deductible to start the year.
But you're still working toward that maximum of whatever it was, $6,100.
On the 50/50 copay, yeah, that resets.
It does, but remember that 50/50 is on the medical piece, that goes 50 up to 2,000.
Yeah.
So it technically stops at 2,000. The only way to get to that out of pocket is through pharmacy costs.
That stops at $2,000 out of pocket.
For the medical side.
So it's actually $4,000 worth of bills.
Correct.
Yes.
That's correct. Discounted bill, that's correct. And just as an FYI, it's a good comment to make. The share pay plan that the city has, it's 50/50 from $1. Right now, the Kaiser Family Foundation survey came out. The average deductible right now is $1,644. Well, nobody has that specifically. So about $1,500 deductible. Well, the challenge, Dr. You said it specifically there, the employee has to shoulder the entire $1,500 plus their premium before they ever see a benefit, besides the 100% care under the Affordable Care Act. That's given no matter where you go. So the complaint we had for years is that I'm paying all this premium, I'm not getting any benefit. So with the concept of high deductible plans where the employee shoulders even a bigger amount, like I do, I'm on a high deductible health plan, 100% of that I have to pay, 100%, including drugs. So I'm very cost conscious. At least with the share pay, you're cost conscious from $1 because it's your money. And so it's half you, half the plan. So at least you get something. It does cost a little bit more. Why? Because there's an immediate benefit for the employee. But again, we're talking about $2,000 versus, a higher deductible. So it's not a huge cumbersome cost impact on the city's plan, but I'm telling you, it's a phenomenal benefit for the employees. And it does make them consumer conscious too.
Right.
Again, we don't have to decide this today. This is something that, we can say, just look at that as it unfolds. Fine, we'll get the numbers early and have that discussion.
Is there any industry data on tendency of people to delay preventive care because of that 50, the higher that 50, that share percentage goes up? Because the other, effect of a higher pay out of pocket is I just won't have it done. Or I'll wait till I get the money. Of course, that never happens.
I believe there is. In fact, I think Cigna put together a program over the last few years of the impact of the high deductible health plans that, like for me, I think it's, can't remember, I think it's $3,800 is mine. Mm-hmm. Some are $5,000. Some are less, but then I'm not going to get technical, but just a rule of thumb, people delay a care because it's like, okay, I'm having chest pain. It's $3,800. I think I'll wait. Well, I don't want you to wait. Mm-hmm. So there has been some of that, and Cigna did show that. And if you look at the data over the years, the cost of a high deductible plan is actually cheaper than where you're at today. It's cheaper. The problem with that is that the trend lines have been going like this, and they're about even now. So the trends, once that program has been established, the trends are about the same. Now, what they don't tell you is historically, on a high deductible health plan, if it was fully insured or you can talk about the premiums all day long, If you say we're going to fund this plan at $650 for a single person, a high deductible plan is $500. The city's going to say, we just saved $150. No, what you're probably going to do is take that $150 and put it in their health savings account. So the contribution by the city is the same. It has no financial impact on the city. Just how do you want the employee to manage their own care? And so you've got to be careful on pricing differences, because if it's too cheap or really low, everybody's going to take it. And at the end of the year, we don't have $5 million to pay all the claims. It's a weird anomaly, because people will look at that. It's like, I'm going to save the money because I don't have any health issues. And there's other people who say, I'm going to pay the premium difference, but then use it. So it's an interesting challenge, but there is something on Cigna. I'll see if I can find it and forward it through Natalie for you if you'd like.
Mr. Charlesworth, when you say high deductible plan, what kind of deductibles are we talking about?
Well, under the IRS guideline, the minimum deductible, I believe, is $1,500. The challenge with that is that under the family plan, if you have a family and it's 2 or 3 times that amount, this one individual is going to have to meet the family deductible. So if you have a $1,500 individual but $4,500 family and you're on a family, an individual will have to meet $4,500. If it's in what they call embedded, it's $2,850 for 2021. That way, any one individual is capped at $2,850, even though they're on a family plan that may have a higher family deductible. So rule of thumb for me right now, $2,850 for 2021. Sorry, that's a long answer to a short question.
Yeah, and a very convoluted answer, I might say.
I'm sorry. I know what I'm talking about. No. But yes, just $2,850 is the rule of thumb right now for that. Okay, couple graphs. You wanted to see kind of how the cost flows, if you will. The green is the fixed cost, which is claims administration, stop loss, network access, and some taxes. Yes, you are subject to some ACA taxes, not much. $682,000. Expected RX claims, this is the number we come up with, about 5.8. Expected medical claims, this is on the current funding year, right at $4 million collectively. Then there's that aggregate corridor we talked about, that 130% corridor. As you can see, currently it's $1.196, $1.2 million. Well, that's fine, but that does not include pharmacy. Okay? That expected funding change from prior years, about 0.1%. That's using the same number of employees. But collectively, the expected total cost is about $6.3 million as we currently sit today as a city. For 21, what we're looking at, the rate change is actually about 3.9% using 2020 initial enrollment. The enrollment numbers, they change every month, folks, so it's going to skew the numbers a little bit, and that's why that 6.6 rate decrease is skewed, in my opinion. Again, this is the same as we have current pharmacy carve-out, $600,000. Expected pharmacy claims, medical claims. Again, as you can see, a little bit lower because Blue Cross has a 3.5% renewal projection going forward. Again, these are claim projections. So that's good news, about a 4% overall reduction. And then the third one here is if the city would consider rolling in the medical and pharmacy collectively. As you can see, the fixed cost goes up about $124,000 from about $600 to $729. Medical and pharmacy claims. And then there's that $1.5 million number I talked about earlier. $1,512,000. That's that aggregate corridor, that 30% difference above expected for worst case scenario. So now you know where I came up with the $1.5 million number when we first started talking. Again, it's about a 2% reduction using the same enrollment numbers. Funding numbers are a little skewed here because of the lower, about 9 employees lower.
So would we be able to combine our pharmacy with Blue Cross Blue Shield for the 2021 year, or are we looking clear down to 2022?
We're looking for February 1, 2021.
Gotcha.
So what's the revenue flow going to look like with that enrollment information? I'm trying to get to what rates will be. In other words, are you saying we can reduce rates by 4.7%?
I'm probably thinking closer to 2.
Okay.
And part of that's accounting for the employee numbers.
That is
These
correct.
assumptions versus what we're seeing.
Right. And I just, because the city has swings in numbers.
Yeah.
And that's
I
based
get
on,
that.
as we sit today, but I would look
Is
at,
that a current count as of last week or whenever this?
that was as of September 1st.
Okay, all right.
But
So-
that scenario is stop loss on prescription claims,
That is correct.
which is an added cost, but offset by other savings.
Back to those employee numbers, does that include the subgroups or is that the city only?
It's all of them.
That's all, everybody, okay.
So if I recap, I think there's about 4 decision points here. One is the basis on which we calculate a health fund reserve target. Along with that then is when and how we calculate that, but also if we want to put any strategy in place in advance of if we see reserves in excess or reserves falling short. So there's 2 decision points. The other then is whether we want to pursue a stop loss on prescription claims. And then lastly, change in the plan year. I think, believe it or not, given all the financial conversations we've had about financial difficulties, we are making progress on the general fund reserve. We are seeing, I think we have our finances in check in terms of the general fund. We're seeing some opportunity here in the health fund. Might be you could easily justify saying, let's take a conservative approach to the reserve calculation, so we build ourselves a little bit of a balance. And you could also justify now that we have realized the savings, taking on that added expense for the stop loss on prescriptions. The plan year isn't so much a financial decision as it relates to cost, but it's an ongoing frustration and a challenge as we're preparing the budget. We don't know what to plan for budget or health expenses. Synchronizing that in and of itself from a budget standpoint would be helpful, not to mention the other things that HR mentioned. So as we talked multiple times about where's our fund balance and what are we going to do with it, this is the type of detail that I wanted to be sure we had before we started making those kind of decisions.
Is it an onerous task to match medical expense against pharmacy expense just to see how many potential stop loss candidates we would have had for this? And again, I don't know if 2020 is a good year to use, but say 2019. Because, for me, I'm sitting, okay, you got 400 employees, medical expenses, a year and a half later, you probably know what they are. Same for the pharmacy. But if it's not that simple, let me know.
And while we're talking about it, just for the listeners at home, why don't we touch on HIPAA and how we would do that?
Oh, right, yeah, but following, obviously, for your eyes only, we just need, there were 8, there were 7, there were 5, yeah.
I do have business associate agreements with the carrier and the pharmacy provider. I can ask for a encrypted top 20, if you will, claimants, and see if there's a way that I can combine that
And the only caveat I might list that, let's just say one of those top two was someone with multiple sclerosis. Right? One of those drugs is $80,000 a year. Lord help them if they were cancer. Now, if the drug is working, their medical expenses may be almost zero because the drug's working so well.
Correct.
So it's kind of those people who are maybe not, it may not be the top, they may not be top performing in each group, but their aggregate spending may get them over the 150.
Correct. And the reason I said 20, that's usually what I get through a normal report, all encrypted identifiers. But let me visit with Natalie on that. I'm going to have to figure out how I can do that by still following the business associate agreements for HIPAA protection.
Right, because it wouldn't surprise me if there were actually several who, when you combine their medical and their pharmacy, or maybe this is is our employee group considered a younger group than most businesses in town, or not necessarily?
I didn't pull the average age.
Our average age is mid-40s, I believe, the last data that I looked. I don't know about average age of our insureds. So that's what I'm wondering.
That's true, because it's going to be not just the employees, but the dependents, yeah.
Right.
Okay.
And the city has, second here, I can tell you. Unless, Jennifer, do you have the current enrollment? There's several as employee, spouse, and family, correct?
We consider our plus one spouse or one child. I have 69 enrolled and 188 families for just city employees.
Here's what I had from the Blue Cross data that was provided for the renewal. This is just, they actually break it down in 4 tiers for us: employee, employee spouse, employee child or children, and family. But there were 190 employees. There were 63 employee and spouses. That's 126 people. 37 employees with child or children, and then 184 with families.
Right. I think that's, yeah, it's at the bottom of,
At the bottom of that worksheet,
yeah.
that's correct.
I mean, there's a little bit of variation, but yeah. But, between the 2020 and the 2021.
So we have 4 points of decision at this point?
I think so.
Okay.
We don't necessarily need to make a decision today. If you can provide direction, that'd be fine. But I think
Well-
formalizing the method in which we calculate the reserve balance would be helpful. Formalizing when, in terms of the plan year, we do that would be helpful. And then you will have a decision point as we renew on prescription, whether we want to take on a stop loss for prescriptions. And then lastly is the plan year, whether we want to.
Well, I would
amend that.
suggest that what we need is a recommendation from you on each one of those points, and then we can focus our discussion. If we don't do that, we're going to be wandering in the wilderness for some time to come.
I'd be happy to do that.
You know, and maybe we do that at the next meeting or whatever, but I would like to have some focal point for the discussion, because otherwise, we're all going to be all over the board.
And I'm
And this
willing
way
to
we can,
offer that
this
up.
way we can take aim at just one person.
That's what I'm
I
here
mean,
for.
yeah.
I would tell you at this point, given our financial position at the moment, I think we're well positioned to take a conservative approach to the reserve balance calculation. And while we have the funds versus sweeping them somewhere else, now would be the time that we could take the more conservative approach to the reserve calculation. I think it does need to synchronize with plan year end so that we know what our terminal exposure is and we can make some of those calculations. I think the conversation that you've had about trying to hone in a little bit further on our exposure on prescription stop loss is useful, but that if the more we can do an actual cost-benefit calculation there, the better, but that's a significant risk. And then lastly, the plan year, I don't know that we know the rationale why we set it the way that we did, but from a benefits administration standpoint as well as a budgeting standpoint, a January 1 plan year would be much more helpful and productive for us. So I think the only...
When you say conservative approach, what does that mean? Does that mean we're going to increase the target or reduce the target?
Yeah, I'm sorry, I mean fiscally conservative, meaning a higher target.
Okay. Because we have more money everywhere else.
Well, we have sufficient funds in the health department reserve fund, or the health insurance reserve fund at the moment to meet that goal. And in terms of general
We
fund,
already exceed that goal.
right, correct. We exceed
Considerable
either one of these goals. And the issue of up-down swings, I think, has a lot of validity. We're saying we've had a couple of good years, but we've had quite a few years where we've had the opposite conversation.
But if you look
so-
at the history, our balance has never fallen below the target in the last 8 years or so.
Right.
My perspective is the balance should be above and below the target consistently, and we need to manage towards the target instead of trying to treat it as a minimum.
If the target is well based on, I want to use the word fact, but
It's clear
to
that
the
it's
extent that you
well-placed,
can.
based on Mr. Charlesworth's recommendation. Somewhere between 2 and 2.5 million.
Well, and I also think that in terms of policy questions, it would it would be helpful if we came to some understanding about if the results are positive or negative in terms of our balance. Are we looking at a premium holiday? Are we looking at reducing rates? Are we, how exactly are we going to manage that? I mean, that's something that I would at least like to have that set out so that everybody's expectations are the same.
I agree. I would like to see some structure to the discussion, though, so we can talk about prescription plan location is one thing, how we address an overage and the fund balance is another, the target itself is another, and then I forget what the fourth is, but I think we need to deal with those one at a time instead of each of us talking about a different one as we go through it. And that's why I'm saying I think we need to delay this discussion until next week and either do it as part of the regular meeting with a structured approach rather than have me talk about fund balance target and Commissioner Hodges talk about what do we do if we're above or below it, and Commissioner Davis talk about how do we want to do the prescriptions. We have to develop a focus on this because we've got 4 or 5 decisions here that are somewhat interrelated, but we're going to end up, like I said, wandering in the wilderness if we don't get a focus.
Staff can certainly bring that forward to you. We won't have it ready by next week, but we can frame it up. The previous conversation, I felt like there was a lot of pressure to go ahead and make the decision. So the reason we're having this study session conversation is to explain the breadth of the decision points, and we can bring you a recommendation.
Are the Blue Cross projections for next year, are they influenced by what some people consider to be a pent-up demand for service because it wasn't delivered this year?
Yes,
And were they made early enough in the year to account for what some people think is going to be a bad flu season?
Well, that is a challenge. They do take that into consideration, yes. Your claim data was through June, so they did see some of that coming back. But yes, they do take that into consideration going forward. That's where they come up with their, and of course I gave them claim data as far as the top pharmacy drugs that were used, the top 100 in fact. That way they could see based on the claim data, obviously they couldn't match up the individuals, but they can kind of get an idea of like where do they think their claim costs are going to be based on their discount structure and rebate structure. So that's where they came up with their projection of expected claims for your pharmacy.
Yeah, because I think pharmacy was probably less affected by the
Yeah, I think-
coronavirus than medical claims.
Commissioner Davis, I agree with you.
Because all
Yes.
it takes to get a prescription refill is a phone call, and you talk to a robot at your pharmacy, and you have it. The medical claims part is what I'm, are we going to, and most of these folks probably won't get to 150, but that's more out of our pocket because it is under 150. If half of 2020's health care is given in 2021, then
I thought Mr. Charlesworth said that they'd calculated that to be about a 5% impact, which
is
is
correct.
considerably less than half. And that corresponds with some of the stuff I've read in the insurance industry, and I forgot the company name now, but they're one of the world's largest providers. And I could look it up again. And I think the estimates then, and this was a few months ago, were like 3 to 7% or something like that. So the 5% rings true, rings about right. That's consistent with what I've read.
That's what we're finding, at least in the Kansas City market and the central Kansas market. I think Blue Cross uses a 5% as a benchmark.
In other words, that's the delay that COVID has caused.
That would be the delay.
Delaying, what do they call them, optional services,
Is it standard or normal for a lot of your clients to have the employee pay a percent, basically the same percentage of an individual as they do a family? Because a lot of times I've seen where the premium paid by the employee would be considerably more as a percentage of the total premium than just the straight 25% basically that we have, because there's an obviously a significant benefit to an individual that's on a family versus it's on a single.
We could pull information from a lot of public entities, but a lot of the public entities in which I work with, a lot of them have 2 plans, one a high deductible plan, and then what they call a buy-up plan. And many times, the lowest cost plan, the city pays 100% of the employee rate. So I just worked on a city this morning. The employee pays 14%, and the city pays 86%, regardless of which plan you take. So if you look at some stuff from Mid-America Regional Council and others, you'll find a lot of the public entities, not schools, schools are very different, but for the municipalities and counties, you'll find that they pay the bulk of a single rate, and then the employee pays 20 to 25% of the family rate. That is fairly common.
do you give odds on football games?
Oh, sorry, what?
Do you give odds on football games? This is
All I care is the Chiefs keep winning.
well, there's a lot of forecasting that has to go on, and I appreciate the work that you've done.
Any other questions I could answer today for you, commissioners?
I don't think so.
I will try and get some of those, that information on the high deductible impact, as well as if there's a way I can pull the top claimants on both of those. I'll endeavor to do that.
Mr. Scragg, do you need any more direction from us?
And not unless there's additional data or questions that you might have. If this kind of covers the waterfront in terms of the conversation, then we can certainly bring it back to you as an action item.
Just one, is the difficulty in combining those 2 lists of top users that they're 2 different companies? Just occurred to me that the pharmacy benefits are now through a different,
2 different companies and
okay.
two encrypted systems.
all right. Yeah, in my mind, I was thinking, okay, that company should have these 2 lists, but it occurred to me that's 2
Correct.
companies, okay.
And if it's not possible, I guess we all have our different preferences on how important taking a look at that is. But I also, if it's not something that's doable with the encryption and with HIPAA, then I think that we make our best guess based upon the information that you've provided us and staff's direction, and take it from there.
Well, I can give you, and this has been our company's historic perspective, what I would do if it were my company and my money. I'm not shy about telling you that at all.
So combine,
If it were
January 1,
if it were
combine-
my company and my decision, what I would look at would be combining the pharmacy and the medical under Blue Cross Blue Shield of Kansas with the Prime Therapeutics at the 150,000 stop loss level to have protection there, and the aggregate funding it there, probably funding it close to where you're funding it today. You can take 2% off. I mean, it's city funds and employee funds. Going down kind of scares me with the issues of what we might see. So I might recommend funding it as you currently fund it today. I would establish, at least the first year, I would establish the reserve fund to be twofold, a minimum of the $2,050,000 and a not to exceed of the $2.4 million. I'd probably put a range in there if it were my money. That way I'd have that parameter where we're going or not. That would be decided in October to implement some either refunds or refunding in December. As far as plan year, I think I'd like to wait until 1/1 of '22 to make that decision. I'd like to weigh the differences of the impact of enrollment and coordination with employees and their spouses, if that's going to be an impact or not.
Thank you. Appreciate it.
I guess that's the question we should have asked about 20 minutes ago.
Yeah, exactly.
It's not my decision, though, okay? Please.
Bob, correct me if I'm wrong, but you've looked at the prescription plan in the past. That's not always been your recommendation, but it's kind of evolved.
Oh, it has not. I mean, it's, the current provider has done a very, very nice job, in my opinion. I think the city and the employees have saved money. They've been managed well. They've got some good programs for the employees. I just am nervous seeing not so much the cities, but our other public clients that we have, the impact of pharmacy on claim costs and how that's controlled and coordinated between stop-loss carriers. Call me paranoid, call me what you like, but based on today's times, I think that would be why I'm making that recommendation at this point. That's what I would do. I'd pull it all together. The pricing is good. The stop loss is good. It came down. We can roll it in. To me, it's aligning correctly, and it would be a good time to do so.
One thing I hadn't thought of, but you just mentioned, is it easy to get a list of the ancillary programs that Elixir currently has that our employees are using, that Prime Therapeutics?
They have similar programs, but yes, we do have that information already, in fact.
Okay. Thank you.
Yeah.
Do we know how long we've been using Elixir or its predecessor name? It seems like we've been using them for many years.
10 years, probably,
10 years.
Commissioner France?
I think we started probably with Blue Cross Blue Shield and then shifted to them at some point. Shake your head, Natalie. I don't remember.
We had Caremark.
Oh, yeah, that's right.
Oh,
Yeah.
mercy, don't
Right,
bring that up.
Yeah, yeah.
I think that was the reason we recommend the city make a change at that time.
Right.
Okay, if there's no more questions, I guess we'll be back in here at 4 o'clock for the meeting.
Thank you, Mr. Mayor.
Thank you.
Thank you.
Anecdotally, we dread
Okay, it is 4 o'clock. I will call the October 26th Salina City Commission meeting to order. I would first look at staff and ask if confirmation of the Kansas Open Meeting Act required notice has been properly provided.
Yes.
Thank you. With that, we will have roll call.
Mayor Hoppick,
Here?
Commissioner Davis,
Here?
Commissioner Franz,
Here.
Commissioner Hodges. Here. Commissioner Ryan.
Here.
Thank you. Will those who are able please stand for the Pledge of Allegiance and a moment of silence? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. Okay, well, that will move us into awards and proclamations.
Item 3.1, the day of November 1, 2020 as Extra Mile Day in the city of Salina. Brenda Gutierrez, Program Director at the Salina Area United Way, will read the proclamation.
Good afternoon, Brenda Gutierrez with the Salina Area United Way.
Brenda, you might pull that microphone down, please. There you go.
More like that?
That'll work better.
All right.
Thank you.
Yeah. Whereas Salina, Kansas is a community which acknowledges that a special vibrancy exists within the entire community when its individual citizens collectively go the extra mile in personal effort, volunteerism, and service. And whereas Salina, Kansas is a community which encourages its citizens to maximize their personal contribution to the community by giving of themselves wholeheartedly and with total effort, commitment, and conviction to their individual ambitions, family, friends, and community. And whereas Salina, Kansas is a community which chooses to shine a light on and celebrate individuals and organizations within the community who go the extra mile, all in order to make a difference and lift up fellow members of their community. And whereas Salina, Kansas acknowledges the mission of the Extra Mile America to create 500 extra mile cities in America and is proud to support Extra Mile Day on November 1st, 2020. Now therefore, I, Michael Hoppick, Mayor of Salina, Kansas, do hereby proclaim November 1st, 2020 to be Extra Mile Day. I urge each individual in the community to take time in this day to not only go the extra mile in his or her own life, but also to acknowledge all those who are inspiration in their effort and commitment to make their organizations, families, community, country, or world a better place.
Thank you, Brenda. Is there anything special scheduled for that day or some around that time?
Weather permitting. Thanking others who are really doing a lot by going the extra mile. Last year for the extra mile, an example is we did handwritten thank you cards to anyone that served as a volunteer on a county advisory board or a city advisory board. So as you can imagine, you folks appoint those, and over 200 postcards went out to thank. So looking back, that's something that we did in the month of November last year, and we're going to change that up a little bit this year with the, I say the C word, COVID and the virus, thanking folks that we acknowledge have gone the extra mile to help us all get where we are and moving things forward.
Well, Salina is blessed. I know this summer with COVID and with some of our budget restraints, we had a lot of individuals that stepped forward to help in different ways, and that's a perfect example of going the extra mile. And any of those that happen to be listening, on behalf of the city of Salina, we thank you for that. So, Brenda, I have a proclamation for you. Okay, that will lead us into the Citizens Forum. This is an opportunity for anyone who would like to come forward and talk about something that is not on the agenda. We ask that if you come forward, you please give us your name and where you're from. Okay. With that, we will move into the consent agenda.
Item 6.1, approve the regular meeting minutes of October 19th, 2020. Item 6.2, approve the special meeting minutes of October 20th, 2020. Item 6.3, approve resolution number 20-7890, authorizing the city manager to permit the Salina VFW Post 1432 auxiliary volunteers to solicit within the city's rights-of-way. And item 6.4, approve resolution number 20-7882, appointing members to various boards and commissions.
Okay, is there an item that any commissioner would like to have pulled off? If not, I will accept a motion to approve.
Mayor Hoppick, I move that we approve the consent agenda, items 6.1, 6.2, 6.3, and 6.4 as presented.
Second.
We have a motion and a second to approve the consent agenda items. All those in favor? Aye. Opposed? Those pass 5-0. Thank you. That will lead us into administration.
Item 7.1, resolution number 20-7893, authorizing the mayor to execute a former Schilling Air Force Base site environmental project management agreement.
Thank you, Mayor and Commissioners. Martha Tasker, Director of Utilities. The proposed former Schilling Air Force Base Site Environmental Project Management Agreement among the Salina public entities includes Kansas State University, Unified School District Number 305, Salina Airport Authority, and the City of Salina. And it provides the financial and administrative structure necessary to enable the Salina public entities to collectively complete the environmental response actions at the Schilling Air Force Base site. And it'll be in compliance with the 2020 consent decree between the Salina public entities in the United States and the consent agreement and final order between the Salina public entities and the Kansas Department of Health and Environment, who in this case is the regulatory oversight agency for this work. In 2010, the SPEs filed suit in federal district court alleging that under federal law, the United States was liable to the SPEs for past and future response costs incurred or to be incurred by the SPEs regarding the environmental contamination from the use of the site by the United States Department of Defense. The suit led to mediation efforts resulting in the 2012 consent decree, which was entered in between the Salina public entities and the United States. The SPEs assumed the responsibility for preparation of a remedial investigation and feasibility study under the regulatory side of the Kansas Department of Health and Environment. The cost for this project was $9.3 million, and 90% was funded by the United States and 10% by the city. KDHE issued its consent agreement and final order, ordering the Salina public entities to complete the remedial investigation feasibility study necessary for KDHE to develop its corrective action decision, ultimately selecting the remedy to be implemented in order to address the environmental contamination at the site. In 2012, the SPs entered into an interlocal agreement for the purpose of administering the completion of the remedial investigation feasibility study, all in compliance with the 2012 consent decree and the consent agreement and final order with KDHE. That phase of the project was completed on time and under budget, and KDHE then issued its corrective action decision addressing the remediation to be completed at the site. Following completion of the remedial investigation phase and the issuance of the KDHE CAD, the Salina public entities resumed mediation with the United States, which led to what we now call the 2020 consent decree. And it was approved by the Salina public entities at their June 24th, 2020 meeting, and just this week was approved at the final level with the United States Department of Justice. So one big step for the Salina public entities behind us. The Salina public entities and the United States will jointly take the consent decree for approval to the federal district court. Upon the court's approval, the Salina public entities will be responsible for performing all of the response actions identified in the corrective action decision in exchange for the settlement payment from the United States. All this work will need to be completed in line with KDHE's issued consent agreement and final order. The 2012 interlocal cooperation agreement was structured in a manner that was prescribed by the Kansas Interlocal Corporation Act, which at the time was the most suitable statutory basis for an agreement among the Salina public entities, and was subject to review and approval by the Kansas Attorney General. In 2017, the Kansas legislature expanded the definition of municipality under KSA 12-2908, and they authorized any municipality to contract with any municipality to perform any governmental undertaking which each municipality is authorized to perform. This expanded definition of municipalities now includes all of the Salina public entities, such that the Salina public entities can enter into this management agreement rather than the Kansas Interlocal Corporation Act, and eliminates the need for involvement by the Attorney General's office. So now we're going to talk about the proposed management agreement, and it's a monumental effort by the Salina public entities and their legal counsel to get this document prepared. It's been a lot of hours of discussion and time. And this proposed management agreement includes 9 sections, 5 exhibits, totaling over 80 pages. So a lot of reading for you there. And I'm going to try to summarize some of the key points of that without hitting on every item, because I'm sure you all took time to read all 84 pages and have it clearly thought out. So at the end, if I missed something that was important to you and you want questions, we have several experts here that can help with the answers. The first section is acronyms and definitions. That's pretty straightforward. The second talks about termination of the current interlocal agreement, preconditions to commencement duration. The 2012 interlocal agreement terminates upon commencement of this proposed management agreement. The proposed management agreement commences upon court approval of the 2020 consent decree and the Salina public entities receipt of payment of the settlement from the United States. And this management agreement will remain in effect till the Salina public entities meet all the obligations under the consent decree and the consent agreement and final order. Section 3 is no separate entity executive group. The SPEs authorize their respective chief officers to serve as the executive group. We'll discuss more detail on that in Section 6. Section 4 is purpose. The proposed management agreement provides for the administrative structure necessary to enable the Salina public entities to collectively complete the activities at the former Schilling Air Force Base site in compliance with the 2020 consent decree and the consent agreement and final order. This will be pretty similar to what was laid out in the previous interlocal agreement, so the purpose is very much the same. Section 5, funding the activities. This is an important section, and I'll cover the highlights of that, but there's a lot here to understand on what's going on. The estimated project costs for performance of the activities by the Salina public entities is $71.7 million, and those costs were identified in Exhibit 2 of this document. The proposed management agreement provides for the establishment by the city of a segregated fund to receive the United States settlement payment of $65.9 million and the federal funds remaining from the remedial investigation and feasibility study project, plus incurred interest, totaling approximately $67.9 million. The project cash flow summary, which is Exhibit 4, indicated additional funding by the SPEs is not projected to be required for removal of the environmental contamination currently contemplated in the scope of work to be prepared in conjunction with the finalization of the consent agreement final order. The proposed management agreement does address the contingent need for additional funding by the SPs. The first case is when the scope of work is consistent with removal of the environmental contamination contemplated, and unexpected and/or additional costs are incurred in completion of the original scope, such that local funds are required. So additional funds are required. The SPEs agree that the city and the Salina Airport shall be jointly and severally responsible for paying all local funds necessary to complete that original scope of work. And the short story of that is the Salina public entities agree that Kansas State University and USD 305 shall have no liability to provide local funds required to complete the original scope of work. The second is when the scope of work, either as developed in conjunction with the finalization of the consent agreement final order, or it's amended based upon some future KDHE requirement, includes removal of environmental contamination that was not contemplated, resulting in future unexpected and/or additional costs, such that local funds are required to complete the scope of work. The Salina public entities agree to negotiate the allocation of such costs if and when those needs arise. The Salina public entities also agree that final preparation of the scope of work in conjunction with the finalization of the consent agreement and final order, any Salina public entity, upon written request within a reasonable time after receiving the consent agreement and final order, be given the opportunity for good faith renegotiation of the terms of these items we just discussed above. So, Section 6, Administration of the Activities, addresses how the activities to be performed by the SPE, Salina public entities pursuant to the CAFO, will be conducted. Just to be clear, the executive group administers all of the oversight for this agreement, and that group includes the CEO and Dean of K-State Polytechnic on behalf of KSU, the superintendent on behalf of the school district, USD 305, the city manager on behalf of the city, and the executive director on the behalf of the Salina Airport Authority. And they're delegated the oversight for the project. The SPEs will utilize a combination of a general consultant and specialized contractors and designate the city to be the contracting agency or the party, which is similar to what we did in the original project for the remedial investigation and feasibility study. The SPEs agree that the interests of their respective contingencies are best served by continuing to engage the Dragon Corporation as the general environmental engineering consultant. The city, in consultation with the executive group, is delegated the responsibility to negotiate the contract with the Dragon Corporation. And in addition, the city, in consultation with the executive group, will identify specialized contractors and contract with each of the recommended specialized contractors, similar to what we did before. There's a provision for potential work to be performed by Salina public entity employees. Haven't defined that specific work, but we have that opportunity in the case it comes into play. On the Exhibit 2, the cost estimate summary, the last item includes community involvement administration, legal, and insurance. The next 3 items kind of pertain to that item. The estimated activity costs for administrative expenses, that's totally the executive group's responsibility to manage and utilize those funds. Reimbursement of the Salina public entities for environmental legal counsel and environmental engineering fees and expenses for work completed from January 15th, 2020 to the effective date of the consent agreement, which I believe will be sometime this year since the tolling agreement expires December 31st. And that's also a portion of that line item we discussed. And the other item is payment of the premium for the environmental third-party liability insurance coverage. 6.8 really addresses the work that the general environmental engineer and consultant staff will provide. Its subcontractors and specialized contractors will be under the oversight of the general environmental engineer. They will assign a designated project engineer for the project to communicate with the executive group. And in addition, they will maintain a field resident manager to coordinate all the on-site activities. Section 7 is termination, amendment, or withdrawal from agreement. Fairly straightforward. Section 8 is manner of acquiring, holding, and disposing of property. The Salina public entities don't anticipate separate acquisition or disposal of property under this agreement. Ownership of any personal property will be allocated by the executive group, and monitoring systems or other systems involved in monitoring the remediation or mitigation of contaminants will be regarded as part of the city's water and sewer utility system. Section 9 is general provisions, more typical agreement type language. Approval by the other Salina public entities have occurred by the USD 305 District Board of Education and the Salina Airport Authority's Board of Directors. Kansas State University Legal Counsel has approved the document and still waiting to discuss it with the president. Excuse me. As described in section 5.4 of this management agreement, the need for additional funds by the Salina public entities is not projected to be required. If contingent funds are needed for additional work, the most suitable funding source needed will be identified at that time. Leading up to this point, you may remember that we had kind of put a placeholder in the utility fund of $10 million, and the Salina Airport Authority has modeled and indicated a willingness to participate in cost sharing. I don't think I'll ever get used to sucking these masks and talking, so sorry for the tickle. As described in section 6.6 of the proposed management agreement, the city will be reimbursed for 1/4 of their environmental legal counsel and environmental engineering fees from January 15th, 2020 through the effective date of the consent agreement sometime later this year. Currently, the city's 1/4 share of these reimbursable expenses, it totaled $79,400 through September 30th of 2020. Staff has identified 4 options for the City Commission's consideration. Approve resolution number 20-7893, authorizing the mayor to execute the former Schilling Air Force Base Site Environmental Project Management Agreement. Approve resolution number 20-7893 with amendments as the City Commission deems appropriate. Postpone consideration of the resolution number 20-7893 to a specified time and date and provide staff further direction. Vote to deny resolution number 20-7893, which would result in the city being unable to participate and provide their city's obligation relating to the former Schilling Air Force Base site. Staff recommends option 1. As I mentioned, this management agreement is a huge team effort by the Salina public entities and their local council. This time I'll take questions, and if they fall in my area, I'll answer them. If they're best answered by one of the other team members here, Mr. Scragg, Mr. Binkson, or Mr. Rogers, we'll bounce the question to them. So this was a very lengthy document, but most of the information was important to make sure that you understand. So I'll take questions at this
Okay,
time.
who would like to start? Anybody have questions? I'll start to my left.
Where is the $10 million placeholder?
Where is it?
Yeah, you said it's in the budget. Is that a part of the cash expenses? Is that in the capital improvements program? Is it part of the rate study?
Yeah, it was part of the rate study. I believe it was in capital.
Okay, and it was presumed to be debt financed?
Yeah.
That's a question, not a statement, by the way.
Yeah, I believe so.
And to
So-
utilize some of our cash also.
Yeah, we had accumulated some
Combination.
cash balance
Okay.
in anticipation.
So removal of this obligation would free up potential resources in that fund, may result in changing the rate outlook on down the road.
Either the rate outlook or the capital expenditures, yes. And part of the decision we probably need to make going forward is whether we want to hold something in reserve just and wait to see how this plays itself out. Martha, do you remember the spend down? We've got a sizable percentage that will be spent down in the first few years, and then we'll know a lot more about what that budget might look like.
Originally, the thought for spend down was to, the larger share, probably 50-60% of the dollars would be spent in the first
3 years.
2-3 years, getting the processes constructed and in place. And then following that, it's more of a monitoring and
So my thinking is if we can get through those first 3 years, we'll know a lot more about, the cash flow projection and whether it's likely that there'd be any costs that we would accrue.
When you say spend down, you're talking about on the $71,700,000.
Yeah, the 68 essentially, but
Yeah,
yes.
yeah, the 60, yeah, okay, yeah, because there's an adjustment there,
in
sure.
Exhibit 4. And it does note that this investment and cash flow projections will be updated quarterly. So really right now, we're a little early in understanding
Okay,
the cost of funding the project and the dollars spent and where we're at economically with.
yeah, I'm just trying to see when we can eliminate the placeholder and maybe reallocate those resources to something else we might need to do.
Right. I think we initially could downsize the placeholder, and then as we get a little bit further into it, we could potentially eliminate it.
Okay.
No questions here.
I did have a couple questions. One, we just got notice that the consent decree's been approved, and it has to go to the United States Department of Justice for approval. Do we have any idea on the time frame on that?
Yeah, we had a call last Friday with our environmental legal counsel, and so it went through the Department of Justice approval process, and now there's a brief that'll need to be prepared by environmental legal counsel, finalized and submitted to the judge. And I don't recall, how long did he say it would take them? I don't recall off the top of my head. I do know that then the court will make a determination whether they want to conduct a hearing on it or whether they'll proceed without conducting a hearing. And they thought it'd be about 2 weeks or so from receipt or filing of that before we knew whether we were proceeding to a hearing or not. So all told, the thinking is to hopefully finalized by year end.
And once that's done, then they write us the check.
Correct.
Okay.
Yep. And then at that point, the blue sheet touches on kind of the effective date of this agreement relative to finalizing the court order and receipt of the funds. So this is all prospective that those dominoes fall into place.
And the Department of Justice has up to 90 days to make the payment to the Salina public entities.
And then we will enter into hopefully a contract with Dragon Corporation, and they will oversee the day-to-day operations of the cleanup, and that's the whole idea behind.
They will oversee the design of those facilities, and I believe they'll probably have a subcontractor that may be overseeing some of the day-to-day efforts similar to what they did on the last project. And then they will also, as we mentioned, have a site person that's on there from Dragon to kind of oversee those efforts. But I think it'll be a combination of efforts.
And all those fees were taken into consideration in the 70 million?
Yes.
Okay.
With respect to Dragon, the agreement contemplates that they certainly have expertise. They were involved with kind of redesigning to reach this agreement. So they're, in my estimation, they have considerable ownership over the design and the cost estimating and implementation. But the agreement does provide an out if for some reason we can't come to a reasonable agreement with them. So if that were to be the case, we'd go through a competitive selection process at that point. But we'll be negotiating directly with Dragon unless that falls through.
Yeah, I would think as much time as they have involved in this, they would obviously.
Yeah, the consistency carrying forward versus bringing in another contractor that may not have, number one, knowledge, but ownership over this whole design and cost estimate is pretty significant in my estimation.
Okay, if there's no other questions, is there any public comment? Okay, with that, I'll bring it back to the commission for action.
Mayor, I move we approve resolution number 207893, authorizing the mayor to execute the former Schilling Air Force Base Site Environmental Project Management Agreement.
Second.
We have a motion and a second to approve resolution number 20-7893. All those in favor?
Aye.
Opposed? That passes 5-0, gets us one step closer, so.
And Mayor and Commissioners, if I may, I know you've heard this before and I know you know it, but this is very exceptional in terms of what it means for our community, the effort that a lot of people, Martha Tasker, Tim Rogers, and Greg Bankston in particular, have put in, including dating back to Dennis Kissinger and Jason Gage. And it's also pretty exceptional nationally for the federal government to basically cash us out and turn this over to us to manage is noteworthy. It's a sizable undertaking, but I think it is a success for this community in terms of being able to control the remediation, get it cleaned up, and part of this whole rationale was with this final payment, we can control our own destiny versus being in protracted negotiations and budgeting with the federal government for decades. This is very, very significant for the community.
Okay, thank you to all the entities involved in that, yes. Okay, that will bring us to 7.2.
Item 7.2, resolution number 20-7891, authorizing the placement of the 2019 People's Choice sculpture on the public property.
You don't look like Mr. Anderson. You're a lot better looking, a lot younger, so.
Mayor and Commissioners, my name is Jason Woolery. I'm the Visual Arts Coordinator for Salina Arts and Humanities. With me today is also Brad Anderson, the Director of Salina Arts and Humanities. Today is presented a request for placement of the 2019 People's Choice sculpture. In coordination with Sculpture Tour Salina, each year the city purchases the People's Choice Award winner. Once purchased, the artwork becomes part of Salina's public art collection. All 9 of the previously purchased People's Choice Award winners have been placed on public property or on private property with open public access to citizens and visitors. The 2019 People's Choice winner was Wheat Harvest by artist James Mages, a Kansas-based artist, and was accepted into the Salina Public Art Collection earlier this year, but it was not allocated a location for long-term installation. Because of stay-at-home measures through the summer and a lack of quorum by the Community Art and Design Advisory Committee, the sculpture has remained in its original install location at Assurance Partners on Iron Avenue. This action item is recommending a permanent placement for City Commission's consideration. After receiving consent by the Building Authority for requested placement, The CAD Committee and Arts Commission are recommending a site outside of the southern entrance of City County Building for long-term installation of the sculpture, as presented in the picture to my right, your left. As previously mentioned, the artwork has already been purchased. Installation expenses, estimated at $3,000, are covered through the allotted Arts and Humanities budget for public art care and maintenance. The following has been identified as possible options for consideration for the Commission. Acceptance of resolution number 20-7891 for 2019 People's Choice Sculpture, Wheat Harvest, for placement on public property at the southern entrance of City County Building. Provide direction to staff regarding an alternate placement of the 2019 People's Choice Sculpture, or deny the recommendation of this work's placement, resulting in storage of the sculpture until a suitable location is found. Now, take any questions. That might be
Questions or comments?
I think my only question concerns the ongoing maintenance of the sculpture, the public art. Will that fall on the city-county building, or because it's a part of our public art collection, is that something that we will continue to address through Arts and Humanities?
So Arts and Humanities will continue to do annual maintenance, just like on all the rest of our public collection.
Any other questions, comments? Okay, any comments from the public? Okay, if not, I'll bring it back to the commission for action.
Mr. Mayor, move acceptance of Resolution 20-7891 for the 2019 People's Choice Sculpture Wheat Harvest for placement on public property at the south entrance of the City-County Building.
Second.
We have a motion and a second to approve resolution number 20-7891. All those in favor? Aye. Opposed? Thank you. I can tell you for a fact that this was a popular piece. We actually had two businesses came forward and would like to have purchased it, but under our agreement with the artists, People's Choice, the city always gets first shot at it. So, okay. With that, we will thank you, gentlemen. With that, we will move to development business.
Item 8.1, consider request to terminate the protective covenants in the Holiday Resort Edition, a residential subdivision located on the southwest corner of East Country Club and Holmes Road. 8.1A, resolution number 20-7894, addressing the request to terminate protective covenants applicable to the Holiday Resort Edition to the city of Salina, Kansas.
Mr. Andrew.
Thank you, Mayor and Commissioners. You should have at your places a copy of a draft resolution that was prepared after the packet originally went out, and the idea behind the resolution would be that it would be appropriate instrument by which the City Commission could make its and record its findings as it relates to this matter. The Holiday Resort Edition is located near the southwest corner of Country Club Road and Holmes Road, near the former Parsons School that's located in that area. In 1993, that property was outside the city limits and was unplatted and not zoned. It was an agricultural piece. There was a proposal put forward to construct a holiday resort nursing home on that property, and it became a mixed-use planned development district, which involved construction of a nursing home, potential future assisted living complex, which has not been built, and there was also the platting of 23 residential building lots. It was a fairly controversial rezoning case. The Planning Commission actually recommended denial of the zoning change. The City Commission ultimately approved the zoning change, as well as annexation and a final plat of the property. And then at the August 23rd meeting, there was a fourth action item on their agenda, and that was to approve a set of covenants and to ensure that those covenants were recorded with the final plat. The unusual aspect of that was the fact that the covenants were made so that they were enforceable by the city of Salina and cannot be amended or modified without the prior approval of the governing body. And so there were concerns, first of all, as to whether the types of homes developed in holiday resorts would be compatible with the homes in Country Club Estates number 4, which is directly to the west. There was also concern about the enforceability and how likely it was for those covenants to be enforced. And so the covenants were endorsed and approved by the City Commission. And we have summarized for you Section 23 of the covenants, which gives authority to any person or persons owning property in the subdivision or for the City of Salina to enforce any violations of the covenants. From that point in time, the city has done its enforcement through the building permit review process. Brad and Crystal Blocklinger they purchased a home in 2019 at the northwest corner of Eastmore Drive and Deborah Drive. This is a corner lot with a ranch-style home. It already has an attached 2-car garage. And they submitted a building permit application to construct a 24 by 32 foot detached garage west of the house. Staff informed the Blocklingers that we could not issue a building permit for the proposed garage because to do so would violate the protective covenants in the Holiday Resort Edition, which only allows attached garages. So we've summarized that language for you. This restriction on detached garages is consistent with the restrictions in the subdivision directly to the west of Holiday Resort, which also does not allow detached garages. So what we've done is not issue building permits for construction that's contrary to what's allowed under the covenants, and this includes permits for detached garages. The city has not issued any permits for detached garage in this subdivision since the covenants were first executed and recorded. There was even a building permit denied on this same lot to a previous owner. Mr. Blocklinger indicated that he and his wife were unaware that there were protective covenants, and they asked city staff what their options were in relation to that. We discussed 2 options. One was to amend the covenants to allow detached garages, or the second option was to simply terminate and release the covenants. The Blocklingers perceived in talking to some of their neighboring property owners that there was more support for terminating the covenants, so that is the option that they chose. There are 23 individual building lots. The covenants provide that the covenants remain in effect unless by a vote of the majority of the then owners of the lots it's agreed to change the covenants, each lot being entitled to 1 vote. So with 12 individual lots, that means at least 12 property owners have to believe and agree that the covenants no longer serve a useful purpose and should be terminated. The release of the covenants also has to be approved by the City Commission, and the document terminating the covenants would need to be recorded in the Register of Deeds office. So this is coming back to you partially because in November of 2019, you considered a request in a slightly different form, and you passed a motion to postpone this item to allow staff to conduct research on the item and return the item to the City Commission at a later date. So this had been before you once before, and you postponed consideration, and so this is being brought back today with our research and with an update of what has occurred. So as we noted, it requires the majority of the property owners to have the property covenants released and terminated. There is no homeowners association, so there's no organized group. That's normally how something like this would be handled, but in this case, city staff and city legal counsel did help by ensuring that the document that came before you today was a legal recordable form that's in a form ultimately in place for your consideration. City staff also assisted by preparing a list of current property owners. City staff also assisted by sending out a mailing, which is attached in your packets. We mailed that letter to all the property owners in the subdivision to assist them with making a decision as to whether they wanted to keep or terminate the covenants. So we summarized on page 3 there the information that we sent out to each and every property owner. And in some cases in the past, we have helped host or found a location for a neighborhood meeting. In this case, we felt like going door to door was not the best option. So to maintain social distancing, we set up a time and place where property owners were invited to come in. If they were in favor of eliminating the covenants, they could come in and sign the document. And we also had a notary on hand so those signatures could be notarized. That event took place in room 107B next door on August 27th. We had 10 owners come in and sign the document. Block owners then went out and obtained 2 more signatures, bringing the number to 12. Following delivery of that document with 12 signatures, city staff received a notarized statement from an owner rescinding their signature on the termination of the covenant, stating they didn't understand the full scope of the signing document and then felt misled into signing it. The city attorney has reviewed both of those rescission documents and found them valid to form. So that if you accept those as valid, then the number is reduced to 10. Mr. Blacklinger went out and obtained 1 more signature from Kevin and Della Berger, but they have since submitted a written affidavit stating that their signature was not notarized at the time that they were asked to sign it. So the original document has 13 lot owners of the 23 with signatures on it, but we've now received notarized statements with acknowledgments seeking to rescind those. If we accept and recognize those withdrawals, that leaves us with only 11 of the 23 lot owners, which is fewer than the required majority. The city attorney has reviewed those and has advised staff that both the termination document and the subsequent withdrawal should be presented to the city commission to allow you to accept and determine the effect both of the termination document and the subsequent withdrawals. Therefore, this has been placed on your agenda for this evening. The city's legal counsel recommends that the termination document and the subsequent withdrawals be accepted and recommends that the following findings be made. That the 2 rescission statements from the property owners have been timely filed prior to your consideration of the termination document, and that the 2 statements have effectively withdrawn the signatures of the 2 lots from that document. So if you find those to be effectively withdrawn, there are not enough valid signatures. Conversely, if the rescission statements are not found to have effectively withdrawn the signatures, then a majority of the lot owners are represented on the termination document, which meets the threshold for your consideration. Staff does want to note, and we've tried to make this clear, but we'll state it again, regardless of the number of signatures, even if it was close to unanimous, the city commission is not obligated to terminate and release the covenants. It is a discretionary decision for the commission. So whether there's 12 or 13 or 15 or 10. If it's under the majority of 12, there's no way for a document to have any effect. But if it's over the majority, in your view, you are still not obligated to terminate the covenants. So we've identified several options. If you concur with the city's legal counsel's recommended findings, you should make a motion to approve resolution number 207894 as drafted. And as drafted, that resolution indicates that you accept the termination document and subsequent withdrawals, and that you find that the 2 rescission statements have been timely filed, and that they have effectively withdrawn the signatures of those 2 lot owners from the document, and that would deny the property owner's request and deny the termination of the protective covenants. If you find that the majority of property owners are represented on the termination document, then you should direct staff to modify that ordinance so that the resolution can authorize the mayor to sign the termination and release document. The third option would be to postpone consideration of this matter to a future meeting date if additional information is needed from staff or property owners within the subdivision to make a decision. I would note that there was a lot of back and forth for this item that has occurred since August 27th. And so what staff did was gave a hard deadline last Monday at noon. No more additional signatures, no more additional rescissions, no more additional submittals. And so nothing has changed since noon on October the 19th. And so the documents that are in your packet have not changed since that time. With that, I'd be open to any background questions. If you have any legal questions, I would refer those to Mr. Bankston.
Well, I don't know if it's legal or not, but is there any reason we wouldn't accept the rescissions, the request to remove their names from the petition?
I am unaware of any reason that you would not accept those rescissions. It was simply a matter of recognition that we needed to present to you what was available and seek your direction on that question.
I have a question. They are 1 short of the number of signatures to compel this to happen?
Does not compel it to happen.
Okay.
It allows it
It allows it to happen, but if they are 1 short, we don't have a choice. We cannot allow it to happen.
If you agree that the termination, that the withdrawals of the 2 signatures make it less than a majority, then you would be compelled not to approve the termination. If you find that the termination, that the withdrawals are not valid, you still have a discretionary decision whether you think it's in the best interests of the public or the subdivision as a whole whether to terminate. So you're not obligated to terminate the covenants if there is a majority, but it would have no effect for you to vote to terminate the covenants if there's less than a majority, because the document, if recorded, would be ineffective.
Okay.
If I may,
I do have a question about the Burgers document then, because it says they contacted us later and said the notary did not witness the signature, but in the blue sheet, it states the notary does not have to observe the act of signing, but does have to be in the presence of the signatory when the signatory acknowledges the signature is his or hers. And on that notarization, the notary indicates that it was acknowledged in their presence. So is that withdrawal valid or not valid? I'm really confused by that.
I don't,
Commissioner, the reference to that circumstance of the question raised about the notary was informational. That signature is not included in the math as to the withdrawals. There are a total of 13 to begin with. The 2 were just simply acknowledged requests to withdraw, the owners of the 2 lots.
Right, okay,
That's what brought it down to 11,
okay.
below the necessary majority. As I say, the discussion about the notary on yet the separate signatures, and I'm sorry, I've forgotten the lot owners' names.
The one in question is Burgers.
Yes. The Burger lot was not included in the math.
Was not included in the map?
In the math,
Okay,
sorry, the M-A-T-H, yeah.
okay.
That takes you from 13 to 11. It was simply a discussion to advise, and frankly, if we needed to go to that issue, the point was that that is correctable if the Burgers presented themselves before a notary public and said and acknowledged that that was their signature. A notary could notarize that statement as an acknowledgement of that being their signature. And I'm sorry, I realize that.
Okay, so the Burgers were on the original petition.
They were not.
No.
They were not. So the way that you can tell that is if you look at the termination document, you will find that 10 of the signatures on the termination document were notarized by Allison Ham on the 27th of August. And Allison Ham is a city employee, and I also witnessed every one of those people sign the document. There were 10. Outside of our signing event that we had here, the Blacklingers obtained 2 additional signatures by going door to door. Those signatures were notarized by a Krista Long. And then most recently in October, the document was taken back out and the Burgers signed it. Their signature was notarized by a Krista Long. And after they signed it, city staff received a notarized statement signed by the Burgers that said that they wanted it to be known that their signatures were not signed in front of a notary public. And so, as Mr. Bankston said, for purposes of determining a majority of 12, we didn't remove the Burgers from that number.
So if they were not signed in front of a notary, why do we have a notarization?
Well, that's a good question. And
I'm at a loss because that makes a difference.
Well,
but
it doesn't, actually.
If the Burgers went forward and remedied the notary issue, the number of signatures would still fall short of the number needed to have a majority.
And the reason we simply noted that was, again, the math on meeting the requisite majority is not affected by that, by the Burgers' signatures.
It is not.
It is not. There's 13 lots represented. If you just take the termination document on its face, there are 13 lots for which the owners have signed and the signatures have been acknowledged. There are the owners of 2 lots that have come forward and given notice of their rescission of their signature, which gets us from 13 lots to 11.
To 11.
Which does not meet the requisite majority for consideration.
Okay, and the requisite majority is 12. Is that correct?
Correct.
But then the Burgers come along and they sign this.
Now, we're counting the
They're
burgers
part
in
of
the
the
13.
They're part of the 13.
The burgers are in the 13. Because the status of the burgers' signatures had not been conclusively addressed, we did not, as staff and as council, did not speculate as to the status of the burgers' signatures.
So they're
Or- and
a
did
part
not
of,
base-
they're already a part of the 11. They were not
If you look
an
at this, they're the
add-on.
second, they're the top signature
Well,
on
yeah, I
page
see
2.
them
Okay.
there, but I don't
Yeah.
understand why we went through all this discussion about, the additional in their withdrawal.
Well, because the document started with 13 signatures, the Burgers raised the issue of whether their signature was notarized or not. So we felt like that needed to be shared with you. But as I said earlier, the Burgers are counted towards the 13. They're not part of the 2 that are removed to get to 11. And so whether their signature was notarized or not, even if that is remedied, you're still left with 11 signatures.
Okay, and if it's not remedied, then we're left with 10.
Correct.
Okay, thank you.
So if I may, another point of clarification, I think reference was made to you as the governing body approving the termination. If this document had the correct number of signatures, you're not in a position to approve or deny the termination. You're in a position of consenting to the termination as a party to the covenant. You're not in a full, approval role. We, in 1993, were made a party to the covenants along with the homeowners, and your role is, if the termination were perfected, which we do not believe that it is, you could either consent or not consent as a
Okay,
party.
I get that. So the question is, if we don't have an option of actually making a decision, why is it in front of us?
I'll be happy to answer that. And I understand that's a totally understandable question. I recommended that it come before you for 2 reasons. One, when you initially considered the matter, you directed that it be brought back to you. And secondly, I did not regard myself in my role, my advisory role, of being in a position to make a determination, as a matter of fact, of whether the city accepted the signature rescissions and expressed my thought that really it seemed to me to be a governing body function rather than even a staff function to bring to you the facts of the matter as they are presented, particularly since it had been directed that it be brought back to you, and that as the governing body, it was your role to evaluate the information that we now have regarding this matter. And that's what led to my recommendation that it needed to be brought back before the governing body.
So our real choice is to consider the reasons that the signatures were rescinded and determine if we think they are valid or not valid and whether or not to accept those rescissions.
If you wish to go that far in the analysis, I suppose that is your prerogative. As I indicated, I believe they are valid as to the form. They are properly stated. They are properly acknowledged. And from that standpoint, they presumably represent the intent and desire of those who signed the rescissions. I might point out, and hopefully this is helpful too, the reason for the language in Section 3 of the proposed resolution is that if the rescissions are accepted, it becomes, the question really becomes moot. And that's the reason for the description in section 3 that if you choose to accept the rescissions, that in section 3, it indicates the governing body therefore concludes that the question of whether the city consents to the termination document is rendered moot. It is, I think, if you accept those rescissions, a moot question, and it's in practical effect that the request of the applicant is denied by virtue of the mootness.
And your, I don't know if to call it a recommendation, but your statement as the city's legal counsel is that indeed those rescissions are proper, and we really have no grounds for saying we're not going to accept them.
That's certainly my view of the matter, and part of that, as you might expect, is given that they were delivered and provided in advance of your consideration of the matter. I think there's no, I don't know of any law that dictates exactly where that line is, but it seemed as though notification of a rescission prior to your consideration of the matter would be deemed timely.
Okay, thank you. I had 2 more questions, but by now I've forgotten what they are.
I just wanted to clarify that the provisions that say that certain protective covenants can't be amended without the governing body's consent is not entirely unusual from the standpoint if you have a residential subdivision and that residential subdivision has covenants that obligate the property owners to maintain the private streets in those subdivisions. We don't want the homeowners association to unilaterally amend the covenants and turn that responsibility over to the city without the city commission consenting to that. So that particular language about the consent is not unusual. What is unusual in this case is that the city is an actual party and enforcer of the covenants.
I had a couple of questions more generally than I think specifically to this, but do we hold that position in very many other subdivisions in terms of the role that we play?
This is the only one that I'm aware of in my experience where I'm actually keep a copy of the covenants at my desk like the zoning ordinance, and when I have a building permit, I review those. I don't do that in any other subdivision.
Okay. And then I'm not sure who this question is for, maybe for the mayor, but when someone purchases a property like the Blockling did, they indicated in their correspondence that their realtor didn't know about it, it wasn't disclosed to them. At what point would that typically happen that you know you're purchasing a property and somebody says, oh, by the way, there are covenants in here?
Well, I'm sure the mayor can speak to that because of the vast number of residential closings that he does, but in an ideal world, the realtor who has the property listed would disclose, would be knowledgeable about whether there's covenants or not covenants.
Do their due diligence,
or whether
in
the
other words.
streets are private or
Okay.
public, and they would disclose that to the buyer. But in that case, it didn't happen. On the other hand, every property buyer gets a title report prepared by a title company, and that title binder or title report will call out things like covenants, easements, things like that on the title binder. Often they're on page 2 or 3. The other thing is that oftentimes those are handed to them at the closing when the decision has already been made to purchase the property. So
I got you. So really,
yeah.
it comes down to the person representing the property for sale.
And this has been an ongoing thing. If you drive around the community, you will, particularly say on Marymount Road, you will see that if you drive down Marymount, certain street signs are green and then certain street signs are white. And so what we found was that a lot in the realtor community were not disclosing to people that their subdivision had private streets that they were to maintain. So one of the things that was done is that private streets have white signs and public streets have green signs, so that even if it's not disclosed to the buyer, you can look for yourself and say, that has a white sign. That means the city's not going to maintain that street, and that I would be obligated. So that was done by the Planning Commission partially in response to complaints and concerns received that no one told me that the streets in my subdivision were private.
Thank you. That's all I have.
Any other questions or comments?
And I didn't know if you wanted to amplify on that, if I correctly described the closing
Yeah,
process, but I have sat down with people and
I believe I
showed them.
can comment on this because I didn't do the title work. So I went back and looked to see, but yeah, the title company that did that, there should have been a commitment that was issued that would have showed plating, covenants, restrictions, all that on there, and then on the final, on a B2, and then on a final policy, they should have been listed also. So.
Thank you.
Having said that, having bought homes, it can be overwhelming. That process can be overwhelming. There can be a lot of paperwork, and you well know me. I'm the guy that says, hang on a second, I want to take a look at this, and there's a lot to go through. It can be easily overlooked, in my estimation.
But in an ideal world, people who are looking at a property, that the realtor who's listing the property would be knowledgeable of that and share that with the owners. I saw the report that was prepared by the sellers in this case, and in the box where it indicated, is this property subject to restrictions or covenants, it was marked no on the information filled out by the buyer or by the realtor. But nonetheless, the covenants were recorded and of record. The other thing is, I think when I look back in 2009, there was a building permit applied for at this address for a detached garage, which we also turned down because of the covenants.
Dean, you said the information filled out by the buyer, but I assume you mean the seller?
Yes, I meant to say by the questionnaire that was filled out by the seller of this property that owned it before the Blocklingers purchased it. They provided me with that form, and whether it was filled out by the realtor or by the sellers, the box where you indicate yes or no, whether there were restrictive covenants, the box was marked no on the form.
Okay, I remembered my other question. The Blocklingers submitted us a document with a number of pictures that purport to show a number of covenant violations in the neighborhood, and I don't know that that has any effect on how we treat this decision. But are those valid concerns? And if they are, if we're not able to enforce those, then
I'll try.
And I'm not sure where I'm going with that. It just strikes me that if these are valid concerns, then it seems like we have work to do. Right. To try to get better at enforcing those.
Well, staff had a conversation about that and what enforcement looks like. And as Dean mentioned, our interest in our interest is to protect the city's interest, whether it relates to plating or whatever assertions were made at the time the Planning Commission said the covenants are important. So that doesn't mean we necessarily have an interest in landscaping or trailers or parking as much as plating and some of the other elements of the subdivision. And if you look at that language about enforcement, it's really pretty standard language that any party to the covenants can pursue enforcement by legal remedy. It doesn't necessarily empower the city to have extraordinary enforcement powers beyond what an individual homeowner could do by taking their neighbor to court. I view our role and what Mr. Andrews has been doing with it in terms of the building permits is we're a party to the covenants. We don't want to be party to a violation of the covenants. So we're not necessarily enforcing them, but we have a role, we have a dual role as a party to the covenants and issuing building permits. and we're not going to issue a building permit knowingly violating the
That violates the covenants, but
But we're
other
not necessarily going to patrol the residential neighborhood and enforce them
But
in their
as
entirety.
as within any restrictive covenant, enforcement of those covenants is actually a responsibility of the residents in the neighborhood or the homeowners association. So if these improvements that purportedly violate the covenants do so, then any of the neighbors could have taken action to keep that from happening or to have it repaired.
Correct.
And I suppose if we knew about them, we could too. Of course, we'd have no reason to know about landscape changes and so on.
Correct. Now,
Outside of zoning requests.
The one assertion that there's 4 cars in a garage, that could have been something we overlooked at the building permit. The remainder of that, I think, is between private parties.
Okay.
That modification was actually approved by the City Commission in 2007 for the 4-car garage.
Were we aware at the time that that was prohibited by the covenant?
Yes.
But I think, if I understand this correctly, but what the people back in 2007 were asking for was a one-time exception, basically, and what we're looking at now is just to eliminate the covenants altogether. Am I characterizing that? I can't talk correctly?
The approach that was taken in 2007, the legal counsel has advised me that that approach was taken at that time was probably the incorrect mechanism by which to do that, but it did not happen unobserved. The item did come before the governing body, but the same thing that we're discussing here is what should have happened then and didn't happen then. So it wasn't the fact that it was unnoticed, it was the fact that we didn't address the issue correctly in 2007, and we are correcting that now.
Okay, if there's no other questions for staff, I'll open it up to the public if there's anyone that would like to comment. Please state your name and where you're from.
Brad Blocklinger and Crystal from here from Salina. A couple things. Dean mentioned originally that we had signatures. Back in February, me and my wife walked the neighborhood and received signatures. We had 2 different forms. One was to abolish the covenant altogether, which we got 12 signatures for that. And then we got 15 to amend it to just so we could build the detached garage. I had more approval for that. There was a few people that said, I don't want the covenant to go away, but I have no problem with you guys building a garage. So I'm not sure if I misinterpreted that or didn't tell Dean that correctly, or he just misunderstood me, but that's the way we went. And I don't want to blame this on Dean, but I was going with his advisement, and I took it as that you guys really don't want to mandate this anymore because there's so many violations, as we've been noted, that is not being enforced. There's an empty lot there that's set open for 25 years since this covenant come in place, and they have 6 months to build on it, and nobody's built on it. These owners own the house on Presley, and they just have a garden there, half of the lot or a quarter of the lot or whatever. And so that's pretty easy to spot just by driving by. And there's been nobody to regulate that, nobody to say, hey, you've had 25 years, let's get it sold, build on it, something. So it's kind of disheartening that you have to have a permit before any of this comes to light. As far as the Booger's signature, I always want to clear up, I wasn't trying to do anything shady. My notary that I brought had back surgery 2 days before, and she was in the car. She seen the paper that wasn't signed. She watched me go to the house, come out, and we just walked down the sidewalk, and it was signed. So she knew, obviously, and she seen Mr. Berger open up the door, and I was in there talking to him for quite a while about other stuff. But so that's what we took as she witnessed it. She just couldn't get to the door very easily, and she said, well, I'll just stay here in the car. I'm really hurting. So that's how that came about. And we had a deadline date for signatures to be turned in, and I had followed up with Dean on when we were coming in front of you guys, and he said, well, we've had a person recant their signature, so we're going to be down to 11, and you'll need to go either get somebody else or whatever you can. So I went to the Burgers Inn and applied that. I did not know till today when I got the email that there was 2 taken out. So, and I didn't turn the signatures in until the day of the deadline, that additional signature. So were both of them recanted at the October 9th deadline or whenever that was? Because to my knowledge, or maybe it was October 7th, I believe, was the deadline at 5 o'clock. I did not know about that. Really, I just want a detached garage. That's all we were wanting. Like Dean pointed out, in our closers or sellers closers, it was marked no HOA, and in the next box was no governing body. And the real estate company was the buyer and the seller. It was the same company. So whether that whole company as a whole, didn't know it at the time. But that's why we were under the assumption we could build. I don't remember signing it. Like I said, we have so many papers at the time of closing. I don't believe that was ever brought up to us. And I guess the signatures that were recanted said they were misled. I would like to know how they thought they were misled. They came down here. They had the same packet that everybody else. I sure didn't tell them anything different that was on the packet. And it seems like there's been 3 people that's been approached. I know there's some homeowners that are against this covenant to go away that have made a point to go talk to the other residences, which that's a prerogative. I wonder what was told to them to convince them that this is not, something that is best for the neighborhood. Because they signed, both these people signed in February. I didn't have it notarized at the time. I still have the paper that everybody signed, but me and Dean miscommunicated there. I thought it was just, he gave me a form of all the residences, and so I just had them people sign under their name at each place. And then he's like, well, that's not a legal document. We have to have it notarized. And that's when we came to going down here. And mind you, this is back in February. And I'm at everybody's houses a couple times. We walked the neighborhood several times getting signatures. And then so I had, people went out of their way to come down here to sign. And then all of a sudden, a week or 2 later, we don't want our signatures in there. So it doesn't seem quite right that they went out of their way to come down here to sign, and then all of a sudden we don't want to have the signature anymore. So, it's kind of odd that something was said to talk them out of it, and I don't, whether that was true or not, nobody's going to know that. So, if the covenant, if there's not a signatures or whatever the decision is there another route we can go to just amend it? Like the house that has the 4-car garage, it was the one-time amendment so he could add his 4th stall. He already had a 3-car garage. He just added another stall to it. I would like to just amend it so I can at least build the garage. Covenant, like we said, really isn't enforced, other than when you need a permit. So I wouldn't need anything else because the landscaping and everything that's been brought up isn't really enforced by the city like I read the covenant to read.
I think depending on the decision made here today, if you looked, if you want to address in a different direction, I would say you need to take that conversation up with Mr. Andrew.
Okay.
So
that can't just be brought up today too with it.
I don't know if we want to, I think we're dealing with this today. I think you'd need to talk to Mr. Andrew about what your options are, if you have other options. Yeah.
Right.
Yeah,
Okay.
I think we're headed down the signature route for amendment.
Yeah.
And then in answer to your other question, it looks like the two rescission documents were dated October 1st and October 7th.
Yeah, I looked.
Okay.
If I might pursue I do have a question. You said that when you started this, you were looking at both requesting an amendment and a rescission and or a termination, and you actually had more support for the amendment than you did the termination. Okay, but you elected to pursue the termination based on Mr. Andrews' advice?
Yes.
Okay.
Just simply because he was under the impression that you guys are no longer wanting to govern this anymore. It's it's the only one in town or the second. I don't know. I thought there was one on Pine Ridge, but maybe I was mistaken on that.
Okay, thanks.
But at that point, there were enough signatures for either option?
Yes, there was.
Okay, so nobody actually put their name on the paper saying we're okay with this in either case?
Yes, they did. Yes, they signed it. It just wasn't a official form that had been notarized.
Okay.
But
Correct me if I'm wrong, but the assessment at that point was you had a majority for termination, and you had even more in support of amendment rather than termination.
Correct.
And so our choice was to proceed with the termination.
Well, the advice was, if there's support for termination, that
By all
cleans up the
means,
record.
let's do that, and that was
pristinely.
based on our interest in not wanting to enforce it anymore?
Well, I think for clarity, if you've got a majority of the people that are willing to terminate it, then it's a non-issue at that point.
Unless somebody steps forward and rescinds it.
But we don't.
I don't think we anticipated that, no.
Okay, all right.
I think that was part of it. With respect to enforcement, amendment would have taken us out of the enforcement role, or termination would have taken us out of the enforcement role.
But we're not actively enforcing the covenant per se. We're a party to prove something, but we do not go around to make sure. It's not our job to make sure that it's being enforced. Is there a homeowners association that does that?
Not a functioning one.
That might be a problem that needs to be corrected before you go any further.
Originally, I think the covenant stated that there was a committee, and it had 2 or 3 people in this committee, and I think they were kind of in charge of. I believe they lived in the neighborhood at the time. I don't think. In fact, I know them names aren't any of the homeowners now, so they've either.
Has the committee met in the last 2 years?
Sorry.
Has the HOA met in the last 2 years?
No, I think that covenant or that committee is void. Because like I said, this was 25 years ago, this committee of the 2 or 3 people, and them names aren't even in the home on the ownership anymore. So, and after the 25 years, it says you can go down to 10 years. Every 10 years this gets reviewed or whatever. Well, that was in sometime in 2019, I believe, and that didn't happen either. There was no review process to say, hey, this committee is no longer intact. These people aren't in this neighborhood anymore. Why don't we have something in place? So.
And that's not an entirely uncommon occurrence for homeowners associations, unfortunately. It's kind of hard to maintain that organization and momentum.
So whose responsibility is it to resurrect it?
The homeowners.
But wouldn't that have to come to a vote also? something, because there's no homeowners association.
I think I've reached the limit of my legal knowledge on this one. How do you reconstitute? I'll turn to the city attorney.
Generally, those take the form of a Kansas not-for-profit corporation, which I assume does not exist if it ever, no longer exists if it ever did. So basically, it's a matter of organizing under a not-for-profit corporation to operate as the homeowners association. That's generally how that would occur.
Any other questions for me? I don't think I have anything else.
Okay, thank you.
Well, is one, I wouldn't personally worry so much about why the two people rescinded their signatures. I mean, I wouldn't want you to think that you had neighbors who were misleading them, because they could take the same argument that you misled people into signing. So for whatever reason they wanted to change their mind, they were entitled to change their mind.
Yeah, they were just, I didn't mislead anybody from the, because they had the packet, and, I just, some of them, one of them I didn't even go to the door. They just came to the signing. So, but anyway, okay.
And if you ever see our meetings, well, I'll speak for myself again, I changed my mind a lot.
Okay. Thank you.
Thank you. Yeah, anyone else?
My name is Ken Creer, 2730 Deborah Drive. I'm directly across the street from the block linkers. I would like to address your question, if I could, about the notary public. I called the state of Kansas. 101 they stated is you have to be there and witness the signature. So that's for that I can answer that. Okay, I'm not sure, as we've discussed, why we're really here. And I've talked with the city attorney on this, because they don't have enough signatures. That was very clear in all the forms that came from the city. So, and I was a realtor, and I'm very aware about covenants. They're really easy to slip through. That's why you're supposed to do your due diligence. Now, this broker, or realtor, was also a broker, so he's well educated beyond that. So if anybody should have known that, that would have been something he should have done. I have been told that when they found out that they had sold them a lot, they came to them and said, we will allow you to pick out another house, lot, whatever. We'll move you to no cost through the realtors. So that's kind of a moot point to me. When people look at houses, they go out and try to find a house that they want, in an area they want, in a price they can afford. And that's normally what people do, and then they get to the papers. We had a nice neighborhood. They chose to come into the neighborhood. We're glad to have people there. We want people to keep the neighborhood up. In the covenants, it says no detached garage. Yes, there is one 4-car garage, but it's not detached. This is going to be a 24 by 32 garage. It's going to be a big shop. He also has worked on his car. He has a race car. He was out in the driveway the other day, beating on his truck, taking a dent out of it. So that's what we're going to have in the neighborhood. There also, if you look to the reading of the particular wording in the covenants, there's some question about it. Several of us got together and visited about it. We thought the wording was interesting, so I went to an attorney, we went to an attorney, and asked, and he said, yes, it could be very well interpreted as you said. So I go to Mr. Bingston and ask him how to read it, and I showed him how we read it. And he said, so why are you asking? And I said, because we're questioning it, and I visited with an attorney. Well, as soon as I said that, he was done. He just said, I can't commit to anything. But according to our attorney, the wording is so that they can't change the covenants for the next 10 years. It's 25 and in segments of 10. So that's where we are with that. No one in the neighborhood wants the detached garage. I mean, it's going to be a 24 by 32. It's not just a little garage that's attached to your house. I wanted a garage to my house. Last year I built one. Cost me a lot of money to have the whole front of my house re-bricked so it all matches. I also wanted a 24 by 32 building. I couldn't have it, So what did I do? I went down on Jewel and purchased a piece of property where everybody has a garage in their backyard, and I put my garage down there because it's okay. So those are all the reasons, I think, but the basic one is they just don't have enough signatures, and it wasn't really explained to the people. The other thing we question is that they had a deadline, came down here, he had 10 people come down and sign, which is great. But then when he didn't get the signatures, they allowed him to go ahead and go door to door, which was the exact thing they didn't want to do in the first place. So I just question that. Thank you for your time.
Thank you.
Hello, my name is Rick Nicholson. I live at 143 South Presley Drive. The garage that proposed to be built will be built in my backyard. My wife Bonnie and I purchased a home about 5 years ago. We moved to that area because it was quiet, it was nice, there wasn't a lot of traffic, and people took good care of their property. We've enjoyed living there. We spend a lot of time on our deck, eating barbecue and playing with our dogs and stuff. Although it's a small view of the country, the garage, and it's not really a garage, it's a big metal building, would block our limited view of the countryside, which we do enjoy looking at. It was kind of funny. One time I said to my wife, I've got a few cars stashed around town, and I said, I'd like to build a garage in my backyard, which I have room. She said, you're not going to do that here. This is a nice neighborhood. And it is a nice neighborhood. And I probably would never have done it for that reason. It kind of takes me to the past a little bit and how rules affect people in a town. My first house I bought was on 861 Windsor Drive. Just a little house. I was a bachelor, so what difference does it make? But my neighbor all of a sudden parked a big old 40-foot trailer in his front yard, right parallel to my driveway. I complained about it, and I said, well, that's illegal. Next thing I know, he's pouring a slab under it, and it's parked there. So I step outside my house. I see the trailer like I'm going to see this garage. But it also, so I looked at it every day of my life. It blocked my vision of the traffic. So I backed my car out. I couldn't see it. And it created a big old snow fence. So on days like this, I'd be shoveling snow out of my driveway. It used to, blow on by. So it's just an example of how a little change that doesn't mean something to someone dramatically affects somebody else. Somebody allowed, the city at one time, and this is back in the 70s, allowed people to make a change that I'm sure that they thought was insignificant, but it turned out to be a major problem for me and probably devalued my house. And I kind of, I guess after that I moved over to Venus, another nice neighborhood, and all of a sudden a guy moved in there and had construction business, and we had stuff all over the neighborhood, equipment. Now the police department, finally took care of that. What I'm saying is I just kind of have the feeling now with this situation that's developing with the change in our neighborhood that I've been here before. I've been in a nice neighborhood that slowly degraded. And when you take away these protections, this covenant, no matter who's responsible for it and what's been done in the past, when you take away the protection, when you change an ordinance, whatever you do will lead to the degrading of the neighborhood, the lowering of the property values, and it's more than just my restricting our view of the countryside. So I just ask you, please, don't lift the restrictions on our neighborhood, because we've worked hard to keep it nice. We want it to remain nice. We don't want to see it slowly decrease in value and slowly go downhill like so many neighborhoods in this town have. And we all know that's happened. So I would just ask you to work with us and protect our neighborhood, and thank you very much.
Thank you.
My name's Roger Newell, and I live at 102 South Eastbourne Drive. I was one of the original builders, and that's why we built on that lot. We come from West Republic, a lot of great people there. But as we moved in, the older people that were dying off, those houses were bought up for rentals, like Mr. Nicholson said. People parking their cars on the grass, nothing to prevent this. Okay. But I want to thank you, commissioners, for the opportunity to talk to you. Article 1 of the subdivision covenant states, the general purpose of the covenant was to ensure the subdivision remained desirable and attractive to be enforced by the city of Salina. That's what I and my wife liked about it, because we came from a neighborhood like Rick was talking about. Okay, now, there's quite a few discrepancies that I found tonight that were talked about. And on August the 23rd, 1993, the City Commission gave final zoning and approval of the 25-year covenants, and the covenants were endorsed and approved by the City Commission. That was 27 years ago. Okay. Article 21 of the covenant specifically deals with the end of the 25-year covenants and the beginning of the 10-year extension at said time. At that said time, you could take a vote to remove the covenants in full or in part. No vote was taken in 2018. That was the end of the covenant, not 2019, 2018. Okay? Okay, and it was extended for a 10-year period of time. The date was August 23rd, and no votes were taken, so the covenants were automatically extended and to be enforced. We're now 2 years past that window, and there was no vote to change the covenants. Okay, the Bochlingers purchased their home in 2019. That's way past the time to take a vote. There should have never been a vote. We should never be here talking about this. Okay, they applied for their, I don't know when they applied for their permit, but it had to be after that date. Okay, somehow the city decides to bring this to a vote. Okay, Mr. Andrews set up a time for the voting to be held at the City County Building on August 27th, 2020. He had in his statement there was an opportunity to sign on a rescheduled date if you couldn't make that original date. Okay. There weren't enough votes. They only had 10 votes then. Okay. 2 of the original 10 were retracted. That brings you down to 8. Okay. They didn't get enough votes at the scheduled time or that date. Okay. And Mr. Andrews told me he only witnessed 10 of those votes. So 2 of those votes were retracted. So all the other votes were acquired by Mr. Bottlinger and notarized by some other notary public, okay, rather than the original plan to be witnessed by the city. If all of these votes would have been witnessed by the city, we wouldn't have had the problem that we have with the falsified notary document that that the city received. There's been 2 legal retraction letters. And also, I don't know how you could count the vote that the Burgers gave if it, when I talked to the state, they said it's a legal document if it's legally notarized. Otherwise, it's an illegal document. So we have to take the Burgers vote out of that. Okay. Okay. Mr. Berger told me that Mr. Blottlinger came to their house, picked up the paper, left. There was no notary there. He did not know the story. He didn't say there was a notary in the car. He did not know. Him and his wife did not know that there was a notary public in the car. There's no notary public anywhere around. So if these signatures have been witnessed by the city as planned, we wouldn't be looking at this falsified document. Also, there are other signatures that Mr. Andrews showed me. So the other 5 that he got, or 4 that he got, were notarized by somebody else other than the city. 2 of those signatures were also notarized by the person that falsified the Burgers document. So do those votes count? So we got a lot of discretion here, or discrepancies, on how many votes are actually to be counted. So they simply don't have enough
About another 30
votes.
seconds if you could. Yeah, so that's me. Yeah, about another 30 seconds or so.
Okay.
If you could wrap it up. Thanks.
They simply don't have enough votes, and some of the votes they have, other votes may be, signatures may be tainted. So I hope that you take this into deep consideration when you vote tonight, or whenever you vote, that there's a lot of things going on here. I want to thank you.
Okay, thank you.
Mayor and Commissioners, I feel compelled to clarify a few things. As we mentioned, there's not a functioning homeowners association, so we can tell that these covenants apparently have become important to the residents of the subdivision, but they have plenty of options of their own doing to reconstitute the homeowners association, to take recourse in a court of law, and part of the reason that it's not advisable for cities to be parties to homeowners association covenants is the expectations that are being put upon you this evening. Mr. Newell read from section 1 regarding general purposes about it being desirable and attractive, and then he closed that by saying to be enforced by the city.
I was going to comment on that. It doesn't say that it was to be
all.
enforced by the city of Salina. Yeah.
Thank you for clarifying that, because I was looking at the section and I couldn't see that terminology.
So with respect to enforcement, and this presumption that the city has an obligation to enforce, Section 23 regarding enforcement provides that it shall be lawful for any persons owning property in the subdivision or the city of Salina to institute proceedings at law. So in a typical homeowners association dispute, one neighbor would be suing another neighbor. We, by this language, have similar ability to file suit if we so choose. That didn't put us in an enforcement role as it relates to the homeowners association covenant. It didn't create, a positive obligation in lieu of the homeowners themselves. And then lastly, with respect to the dates and signatures, staff was trying to facilitate this process. In order to put a date on it, in order to get it before you, in order to bring it back, we did set some dates. But that's a process of facilitation, nothing more. It was not an ironclad deadline here, there, or otherwise. The individual property owners have plenty of individual responsibility and rights they could pursue on their own, separate and distinct to anything that staff's tried to do to assist them.
I think we've gone down several different roads here and I understand that if the block owners want to pursue something else, they can. But I think at this point, we're looking at what's in front of us today. And it appears to me that I'm going to look at my other commissioners and say, if we consent to accept the 2 signatures that were withdrawn, there's not sufficient signatures to move forward. And that's what we're here today.
That's my understanding as well.
So,
Okay, restate that.
if we consent to accept the 2 withdrawals, the 2
Yes,
that were
okay,
done,
yes.
we do not have the 12 signatures necessary. So all the other conversations we're having do not come into play. And it's nice to have this conversation, but I believe at this point, if we feel those 2 withdrawals are meet our requirements, then I think we're done at this point. Did I state that correctly, Mr. Bingston? I always like to look at legal counsel because I can get myself in trouble.
Yes, I think you did, Mayor.
Okay. So unless there is a commissioner that disagrees with that, I believe that.
So the correct action in our
is to do
part
that.
would be to adopt Resolution 20-7894.
No. No.
Which includes,
Would it?
which, it seems strange, but
Yeah.
it states what you just stated.
Right, it makes findings that there are insufficient signatures to go forward.
That's the conclusion.
Yeah, I was getting confused on that too until I read to
Yeah, I was-
to the, until it stated the findings in whatever.
It's almost, it's almost like a reverse proposition in California,
Yeah,
vote
we
yes
read
to say
that
no.
one.
But
Okay.
yeah.
Do we have a motion then?
I move that we approve resolution number 20-7894.
Second.
We have a motion and a second to approve resolution number 20-7894. All those in favor? Aye. Opposed? Okay, that passes 5-0. Okay, with that, do we have any other business to come before the commission?
I had just a couple of things. The first is, I just wanted to express my appreciation to fellow members of the governing body for their commitment to wearing masks as we meet, and to staff as well. I know they're not the most comfortable, but I appreciate it, especially in light of the fact that our COVID cases are growing exponentially. I had a couple of questions for the other commissioners in terms of, right now, I'm getting, and as I'm sure you all are too, I'm getting a lot of emails about people who are not complying with our mask ordinance. And I didn't, especially like in indoor public settings, and I didn't know if there was any appetite among the commission to either require masks in all public places, irrespective of social distancing, or talk about some enforcement strategies that we can put in place, and we can start enforcing the ordinance that we have. And I'm just looking to get some feedback.
I'm getting some feedback too along those lines. And I was going to ask if we could have a report either this meeting or next meeting on what kind of reports we have had of violations and how we've handled those, and what the nature of the enforcement has been on those. I'm not expecting staff to generate that tonight for us, but I would like to know what we've done. And, I guess the question is if there's an appetite, if I might use your terms, to modify our approach.
Yeah, I think from where I'm sitting, I think it bears some discussing.
Fully agree. Coronavirus is not going away anytime soon, and it's about to be complicated by the regular flu, if you dare use such a term, and what cold weather does as far as pneumonia. Those people who are at risk are going to be even more at risk with the regular wintertime weather coming. And I keep saying, our hospital only has so many beds that can be dedicated to taking care of people sick with this. And a lot of folks who are in our hospital don't get counted on our county rolls because they're residents of other counties. Other counties send their sickest people here. And we're about to enter just our regular busy time of the year anyway for illness. The building looks large from the outside, but limited number of beds, and even more scary, there's a limited number of people to take care of folks who are patients in those beds. So we need to keep this down. I'd much rather have a 2-year trickle than a blowout party and do it all in 3 weeks, because most of the folks who would show up in those 3 weeks wouldn't make it.
I think the question, if we want to talk about this, the question we'll have to address is how to expand that requirement, because right now, I will say, probably not without controversy, but walking around and looking and doing counts in various locations, there are people who appear to not be wearing masks when they should, but not knowing what exceptions they might be subject to, it's hard for me to judge. But I would say that, the citizens of Salina have done, I think, an overall and admirable job of compliance. It's walking around, doesn't matter where you go, the majority of people who are in positions of being required to wear masks are doing so. The question with requiring masks in all public places at any time begs the question of how do you deal with eating and drinking and a variety of other activities where, I don't know how you do that, Commissioner Hodges, and and how do we deal with exceptions for health issues? There are things that are just problematic with I don't know how you
I'd
deal
have to
with those
reread
issues.
the order, but how does it state on social distancing? Does it deal with social distancing, the ordinance with wearing masks? I can't remember.
If you're indoors, you have to be greater 6 feet or greater apart,
So
correct?
You get into that. I have a real problem with being able to handle, and I would probably go along with you. I would say we have 90% plus of the people that are following the mask rules, and
You guys must hang out with a better class of people than where I'm going.
But again, within homes or within if you're at restaurants, you're not required to wear them. I don't know.
And that's where a lot of cases come from. Church, I'll tell you how ironic it is. 6 months ago, I couldn't go home because Kansas would make me quarantine if I'd been to D.C., Maryland, Virginia. Now I can't go home because D.C. makes me quarantine because I'm coming from Kansas. If you look up the gut of this country, that's where the rates are increasing.
And, and I understand that it's problematic. I truly do. But as I read more and more about this, as we're learning more and more about how COVID-19 spreads in terms of the aerosolized particles, and understanding that we may be in this for another year and a half, 2 years. At some point, I think that we are going to have some difficult conversations about, how far do we go? Do we wait until our healthcare facilities are at their breaking point? And just it's something I think if we could maybe revisit it every few weeks or keeping an eye on the trends, because if we have a few more weeks like we have the last couple of weeks, that's a lot of burden to place on our healthcare system. So thank you for.
I just think the enforceability is really tough. And I think Jacob, our deputy city manager's been handling those calls and stuff, and.
Yeah, I've certainly gotten all the emails come into my box at facemask@salina.org, and actually it's kind of tapered off. It's slowed a little bit. We actually did write a ticket last week, so this is the first time I've had a complaint that somebody that I followed up with, a business, and said, hey, you need to follow the ordinance, and there was a follow-up complaint about a week later, so we did send a police officer to write a ticket in that case. So we are enforcing it, the best we can. I've contacted many businesses. I don't have a log of, all the places that I've talked to, but I've certainly talked to a lot of businesses. Most of them seem pretty open to trying to enforce the ordinance. I have had some say that all my employees have medical exemptions. So I think that's one of those things that people are at least talking about in the community. So,
is there anything we can do to redouble the public's awareness that we want to reinforce the mask mandate? We don't even have the Salina Journal here this evening, so what options?
One of the things I talked to the staff about Friday was, I think we need to make, if we haven't made it clear, and I'm not sure that we have, that, we'll be nice the first time, as far as educating people. That's kind of what we did with the smoking requirement, is made sure that the businesses and folks understood what the requirement was. But I think once we do that second time around, if there's repeat violations, then we have to step up to the first level of enforcement, and apparently we did write a ticket. So, at the minimum, I just don't know, absent, saying we're going to close places down, how you require masks at places like restaurants and bars and other locations like that where people need their, access to their face to do whatever it is that they're doing there.
And I hesitate to offer it up into the collective consciousness, but it's already been discussed. I think the other issue is the medical exemption. And we've looked at that in terms of HIPAA and some other aspects. What we haven't looked at is whether you would have the option to just remove the exemption. If you truly want to put staff in a position to be able to enforce that exemption without any requirement for verification, that exemption ties our hands.
I think I'm the only one that says, yep, go ahead and do away with them. I haven't heard a board-certified physician concur that there are medical exemptions, with the single exception of perhaps something wrong with the structure of someone's face.
I guess we could certainly check the CDC and the World Health Organization to see what their official recommendation is. If we want to, or even our own,
Actually, frankly, I'm looking at it more from a legal perspective than a medical perspective. The question in my mind is whether you have any obligation to provide it. It would be a policy decision for you whether you want to go that far, but if you remove that exemption, then
you can ask, but they don't have to tell you, maybe. I don't know what the legal
I don't know that we're in a
ramifications.
position to require proof or verification. So if anything, it would be removing that exemption.
Right now in Kansas, they only have to, the person only has to state that they do have a medical exemption, if I'm not mistaken, and they're not required to tell you what it is.
Well, to say in Kansas, the governor's authority has been superseded. So I don't know that there is Kansas guidance. It's on a county-by-county basis.
Or their recommendation, but
I guess there's a distinction between recommendation and requirement, but we're kind of on our own as it relates to requirements. If anything, I think it would be questions of HIPAA and then a policy decision for you as a governing body.
Or ADA, perhaps.
Well, I guess we need to look at that as well.
Yeah, and I'll jump in here a little bit. We did actually have Clark Mize and Linville look at this a little bit, and it actually isn't a function of HIPAA. HIPAA is really more for the health providers. It is a function of ADA, and there really isn't any case law on this at this point. It's kind of too new. So what they've kind of looked at is at the things like service animals. You're really very limited in the questions that you can ask for service animals, and they have found that the ADA rules, the burden on the individual to carry around some kind of proof, that's not something that they've required anywhere. So that's something that we just really don't know what questions we can ask, and we really can't provide them, or we can't require them to provide any kind of proof. So it's pretty hard to get over that burden.
Well, and as clarification, that all relates to a scenario where an exemption is in place, and the questions are what you can and can't ask. The legal question I'm raising is whether you have an obligation to offer up a medical exemption.
Well, I'm in favor of getting rid of exemptions, but I think that's one person isn't going to get it done. So.
Well, and peer pressure. If people stop associating around folks who don't have masks, vote with your feet. You don't want to be on the, I'm gonna knock on wood, you don't want to be in one of those rooms with those funny-looking stovepipes coming out of them at the hospital, because every one of those rooms that's lit up is somebody who's ill with this condition.
If you wish to discuss it further, we can staff it through. I know it's been thrown out, but I'm looking for detailed direction on this one.
I have some folks that I don't claim to be expert in everything, but I know folks who think they're expert in it. I can talk to them.
We can.
I mean, both, and then they would have expertise on both the medical and legal. Certainly have opinions or references.
Is there any other? I'm okay with the way we are, trying to enforce what we have, but that's just me. I'll look to my left.
I'm on the same page. I think we're doing all we can do, and we can remind everybody as informationally, but that's as far as I'm willing to go with it.
And we can step up PR. We can get commercials on.
You know, I would have to say that I am caught in between on this issue, because I know that the masking does make a difference. But I also know there are limits to how severe we can get, as far as nobody wants to shut down again. And I would rather see us try to step up efforts under what we can do now and see if we can make it be a little bit more effective, rather than change the entire structure of the thing and see if we can get results that way.
So education?
Education, follow up with enforcement. You know, when we get reports of folks not complying, I think we need to spend a little effort to follow up on that and, issue the reminder, and then,
But I've got a Commissioner Davis that, it's in somebody's home, and if they're having a group there, I don't know how we control, I don't know how we can,
That's
we
where
monitor
education comes in. It just because you're related to them doesn't mean they're not going to make
And I
you sick.
understand that, but that's what I'm saying, but that's not, but to change, to try to strengthen the ordinance, I don't know, makes.
Oh, I didn't mean not in somebody's private home.
Yeah,
I
but
mean, I
that's-
understand, no, I meant
But you
like
hit
in
them hard
public.
with, that's where the education comes in. Because, the big, there are already recommendations that are out for Thanksgiving, because we thought school opening was going to be a big catalyst. The next big danger zone for this country is the fourth Thursday in November.
Well, this recent growth in cases tracks back to events in August, which had a number of things happening, including schools reopening, some pre-opening activities, Labor Day. There were a number of things, I think, that might have fed this thing. And I don't know how we prevent
You're going to
private
have those with
gatherings
the
and so
holidays
on.
coming up. I don't know
Yeah,
how
it's, the holidays coming up. I just don't know how we affect that, because what people do on their own time and in
Their own
essentially
homes.
private places, we don't have, we have no control over.
But
And I don't know, even if you go to the store, I concur with Mayor Hoppick, when you walk around and look, and I've actually done physical counts and logged off, and it doesn't necessarily apply everywhere, but the places I've went, the larger places I've went, compliance has been, quite good. You always see one or two people without masks, but you don't know what the circumstances are, if they're an exemption or not.
And again, if they're social distancing by ordinance,
And
they
if
don't have to.
they're 6 feet from everybody else, I don't know how you enforce it. And if you did report somebody, by the time anybody got there to talk to them, they're likely to be gone. So it becomes very difficult to do that.
But again, education, because the folks who have the family gatherings of Thanksgiving, guess where they're going to be that Monday morning? At your workplace.
Yeah. Speaking of holidays, my question was going to be, have we received any guidance from the health officer relating to Halloween activities?
Not that I'm aware of, so you.
I mean, that's, there are neighborhoods who churn out the works for this, and that's going to be another case where you have lots of people who don't know each other having contact with each other, and by and large, I don't think the kind of masks that are worn at that event are the sorts of masks that will reduce transmission.
Might have a lot of bandits this year.
Well,
Yeah, I guess.
we're going to get all of our can, and we're going to put them in plastic bags. We're going to have gloves on, and only difference that this year you don't get to choose what you want. Here's your bag, take it. Take
Yeah,
it or leave
but it still doesn't eliminate the contact.
6-foot pole.
A 6-foot pole.
Okay, anything else?
Yeah, one quick, is there any rough ideas when we will next discuss the thoughts, comments, proposals from the policing initiative?
Yeah, we're going to try to staff it up for next Monday. I'm not sure Chief Nelson knows that yet, but no, I need to coordinate with him further.
Okay.
Well, I'll let you tell him. Okay.
With that, I'll accept a motion to adjourn.
Second.
Motion and a second. All those in favor?
Aye.
Opposed? See everyone next week.